Okay. Can you hear me, ma'am?
Yes, sir.
Okay. So I opened in mobile, not in laptop.
शुरू करेंगे. Good morning, everyone. Good morning, everyone. Thank you to each and every one of you being here with us today. Myself, Dr. Pallavi Kulkarni, Professor, HOD, Shareera Rachana Department, Dr. N.A. Maktoum Ayurvedic Medical College, Ankali. I am pleased to welcome all the delegates, today's respected guest speakers for this webinar, Mastishkam 2022, being arranged by Shareera Rachana Department, Dr. N.A. Maktoum Ayurvedic Medical College, Ankali. Let us start our webinar with Lord Dhanvantari Stavan.
कमल नयन श्याम वर्ण पीतांबर साजे मनमोहन वस्त्राने आदिदेव विलसे.
कमल नयन श्याम वर्ण पीतांबर साजे मनमोहन वस्त्राने आदिदेव विलसे.
शंख चक्र जलौका अमृत घट हाती चतुर्भुजांनी अवघ्या दुःखाला पळविये.
जय देव धन्वंतरी देवा सकळ जनांना द्यावा आरोग्य ठेवा. जय देव धन्वंतरी देवा. नमामि धन्वंतरी नमामि धन्वंतरी.
देवांनी दैत्यांनी मंथन ते केले त्यातून अमृत कलशा घेऊन आले.
देवानी दैत्यानी मंथन ते केले त्यातून अमृत कलशा घेऊन आले.
भय दुःख सरण्या जरा मृत्यू हरण्या सकळांना त्याचे संजीवन झाले.
जय देव धन्वंतरी देवा सकळ जनांना द्यावा आरोग्य ठेवा. जय देव धन्वंतरी देवा. नमामि धन्वंतरी नमामि धन्वंतरी.
शास्त्रांचे परिशीलन अनुभव कर्मांचा बुद्धीने तर्काने तत्परती सेवा.
शास्त्रांचे परिशीलन अनुभव कर्मांचा बुद्धीने तर्काने तत्परती सेवा.
शुचिर्दक्ष सत्य धर्म संयत उदारता श्रीकांता सहसाऱ्या आशीर्वच द्यावा.
जय देव धन्वंतरी देवा, सकळ जनांना द्यावा आरोग्य ठेवा. जय देव धन्वंतरी देवा.
Now just take a look at today's event. Our webinar Mastishkam consists of 2 sessions. The topic of first session is clinical assessment of cranial nerves. And for this session, our guest speaker is Dr. Prahlad Subbanwar sir. The topic of second session is time management and paper writing skills. For this session, our guest speaker is Dr. Harshavardhan BB. At the end of each session, our respected speaker will answer the questions asked by delegates. At the end of each session, our respected speakers will answer the questions asked by delegates. So all the delegates can put their questions in the message chat box below. Now I welcome our beloved principal sir, Dr. Ramesh Konkeri sir, the most dynamic, enthusiastic personality who always motivate, encourage each and every faculty for various activities, who helped our department at every step while arranging this seminar. So I request Principal Sir to say few words.
Once again, good morning, everybody. Once again, good morning, everybody. Mastishkam 2022. As a tagline, all you can see, it's taking you to the next level. So our young and enthusiastic teachers from Department of Rachana have thought this by discussing and churning all the topics together and thinking of it and making it final. So in our webinar series, whatever we have conducted till now, our motto has been updating, discussion and knowledge. So this is our main motto here. So for today's webinar, we are having, it's our pleasure and we are honored to have our today's guest speaker, Dr. Prahlad Subbanwar sir from Enapoya Ayurvedic Medical College, Mangalore, and Dr. Harshvardhan Baliyar sir from RGS AMCH Medical College, Roan. So on this occasion, I want to say a few words like the topics taken here, like clinical examination of cranial nerves. So this is an approach where the teaching methodology has been changing in current scenario. So, and even as per NCISM directions that we have to update our students right from the first year. And here our topics, whatever selected, will be very simple, easy to learn in approach, and it will be the applicability of cranial nerves. So these are the main topics here. And regarding the next topic, I can say is it has been thought like seeing the performances of our students in our Ayurvedic faculty. What we have seen is we want to reduce the fear of exams. That is by attempting them gracefully. They should attempt them gracefully with what the knowledge shared by our today's guest speaker, and this will surely benefit all the students facing the exams. So with these few words, I hand over the mic, and I once again welcome all other delegates or all other faculty member, teachers, and all respected resource persons, including our chairman sir, chairman, treasurer madam, and everyone who are joined with us for this Mastishkam 2022. So I again hand over the mic to Dr. Pallavi madam, HOD of Rachana department.
Thank you, sir. Now I welcome Dr. Pakanwa sir, the great teacher, guide, and well-wisher of our institute. I request him to deliver his keynote address.
Good morning, everybody. At the outset, I thank the organizer. May I know, can you listen me, ma'am?
Yes, yes, sir. Continue,
Okay.
please.
Yes, sir, yes.
At the outset, I thank the organizer and chairman as well as the well-wisher of Dr. N.A. Magdum Ayurveda Mahavidyalaya, Dr. N.A. Magdum himself, and principal, the Dr. Ramesh, as well as the HOD, Dr. Pallavi, and other staff members of the Rachana department of N.A. Magdum Ayurveda Mahavidyalaya, Ayurveda College. So, as you know, particularly this particular session is concentrating on the cranial nerves, clinical examination of a cranial nerves. As in our general practice, we can come across with various factors, various conditions of cranial nerves conditions, like maybe the facial paralysis or trigeminal neuralgia, or the loss of taste in conditions of the hypoglossal as well as the glossopharyngeal or damages, etc. So though it is a centrally placed conditions, but we need to understand their clinical manifestation so that we can recognize the conditions at the earliest stage. As you know, the neuromuscular disorders can be treated very effectively by the Ayurvedic line of treatment. But before that, we need to understand, we need to diagnose the conditions at what level, at what stage the disorder, the disease is going to be manifested, as well as it is presently running in the patient's body. So to understand all these points, we need to understand the clinical examination of a cranial nerves. So rightly, they have selected, the organizers have selected a very right person, the Dr. Prahlad sir, who was very vast academic experience, and I think he will throw the light on these conditions in an effective manner, in a simplest manner also. So coming to the next session, the what is so-called the paper writing, or as you know, the NCISM has made very mandatory to produce the papers and to write up the things, you know, in Ayurvedic colleges. Nowadays, it has been a trend, and it has been boosted by the university, boosted by the NCISM, boosted by the teachers. A lot of learned teachers are there in Ayurvedic colleges, and they can boost the the students' mind, and they can also produce the habit of writing the skills, etc. So as you know, the in final year itself, the research methodology has been introduced. So a lot of changes have been taking place in the syllabus of first year as well as second year, in coming years, the third year also, so that the high amount of concentration will be given to the paper writing. I think Dr. Harshvardhan, who is academically very strong, and I know him. He was dealing with paper 1, paper 2, practical, theory, as well as everything when he was in, I think, if I am not wrong, in Gadag Ayurveda Mahavidyalaya. So he was very strong enough to explain the conditions, explain the paper writing skills, the paper writing methodologies. So he will highlight the things. So with this, I thank once again the organizers for giving me an opportunity to make the keynote address to the participants. Thank you once again. Right.
Thank you, Dr. Pakanwa, sir. Now I request Dr. Madhuri ma'am, Professor Shareera Rachana Department, Dr. N.A. Magdum Ayurvedic Medical College, Ankli, to introduce our first guest speaker, Dr. Subbanwar sir, and start the session.
Thank you, Dr. Pallavi ma'am. Good morning to all. I am profoundly delighted to take opportunity to introduce our today's guest speaker, Dr. Prahlad Subbanawar sir. He is working as a professor and HOD at Department of Sharirachna, Yenepoya, Ayurved Medical College and Hospital, Naringana, Mangaluru. Sir has a total experience of 14 years of teaching. Sir has got an award of Dr. Virendra Hegde Pattabhisheka Award in the year 2008 for getting first prize in MD in Sharirachna examination conducted by RGHS, and also got an award Kala Anveshana in the year 2019 for the best paper presentation. Sir has organized 4 seminars. Some of them are as follows. Chief Organizing Secretary at National Level Webinar on the Basic Concept of Sharirachna, Samaveda 2020, etc. Sir has published 9 journals as mentioned below. High origin of radial artery from axillary artery at RGHS Journal of Ayush Sciences. Variant origin of common interosseous artery from brachial artery at JAIMS. A critical review of Kala Sharir at International Journal of Ayurveda and Pharmaceutical Chemistry. A concept of Basti as Mulasthana of Mutravaha Srotas at International Journal of Scientific Research. Sir has attended 2 international seminars, 19 national seminars, and 5 state level seminars. Sir was also chosen as a resource person and chairperson. Sir has done live demonstration of skull dissection as a resource person. Sir has done many paper presentations. Some of them are a concept of Shiromarma Abhigata Lakshanas, surgical anatomy of anorectal region. He has got a best paper award for the topic demonstration of Kala in dissection theater. Sir attended 3 ROTPs as follows. ROTP for teachers of Sharirachna, faculty development program, research methodology. He also attended many workshops. Dr. Prahlad sir has worked for community also. He has given demonstration of organs and bone specimens and importance of cadaveric dissection to 8 to 12 standard students. Now I request Dr. Subbanawar sir to start his session. Sir.
Sir, आवाज नहीं आ रहा है.
Unmute, unmute.
I think mic is not connected.
Hello. Hello.
Ah, sir.
Hello.
Yes,
Am
sir.
I audible now?
Yes, sir. You are audible now.
Okay. Right. Sorry for the disturbance. Good morning, everyone. Shri Guru Bhyo Namaha.
Good morning, sir.
Okay. I just share my presentation now. Then share my. I think you have to enable me for sharing. Host disabled attendance screening like that. You have to enable me.
Try again.
Yeah. I think I just wait. I want to share that. Now, are you able to see the slide?
Yes, sir.
Right. I'm really sorry for this initial technical hitch. So again,
issues.
first I would like to thank my sincere thanks to our college principal and my teacher Pakkannavar sir and all the faculty members of NMGM College, especially the Department of Shareera Rachana, who has invited me for the lecture on the cranial nerve examination. So without wasting much of time, I would like to start my presentation. So first, the cranial nerve examination, that the gist of the presentation will be, there are some different types, divisions, where first, importance of clinical examination, and second point, what are exactly the cranial nerve, and third part is about applied aspects. So how to apply our basic anatomical knowledge and then how to elicit in the patients. So this is what the shloka from Charaka Sutra Sthana, where Acharya is told, before planning your treatment or planning your types of medicines or the type of treatment what you plan, before that you should have a very clear cut idea about the disease as well as its related symptoms, or maybe a prognosis, or it may be related to the certain aspects of the disease. And second shloka is very significant. In Charaka Vimanasthana Acharya told, uh, these kind of diagnosis will be made on what basis? So generally, we follow the rule like we have to follow our aptas, where these samhitas are written, and then after that we have to see the pratyaksha, what we can see exactly in a patient. If at all in certain conditions, we have to guess, we have to make anumana of that particular symptoms to come to the diagnosis. So this is how the important aspects of the clinical diagnosis. So in the contemporary science, if you look at the contemporary science, where how this examination or physical examination come into existence. So it is by in the year 1761, where a person or a son of a barkeeper usually, so that they used to tap the wine bottle to establish the how much is left and how much went to order. So that particular kind of activity, so by just tapping over the bottle, he understood that he has to order. So that kind of one information what he have got from the tapping of the bottle. So that is the point where the son of that barkeeper noticed, and then he put this idea in patients. So that is how it is started with the act of percussion. So in the clinical examination, you know all the basic types of examination. So this is how the type of clinical examination existed. Coming back to the major aspect of this presentation, this is I am taken from your NCISM syllabus, where the entire syllabus is divided into single set of or a small set of explanations where it will give you an idea. Before going to this one, I think in your previous years of education, you learned about certain aspects of brain and spinal cord and the names of the cranial nerve. I think you all remember that. But when it starts from the regular classes in the third term, there individually you read these kind of explanations. So NCISM syllabus made this kind of divisions, like the first introduction and classification, then comes about meninges and brain, the spinal cord, and description of peripheral as well as the cranial nerves. The cranial and the spinal nerve individually you have to study that. And autonomic nervous system and formation and circulation of the cerebrospinal fluid as well as blood supply. So this is a uniqueness of this.
Sir, slideshow में play हो रहा है.
Now you can see this.
No, sir.
No, sir.
It is the first slide only.
Because of this. Now you can see the slides.
Yes, sir.
It is
Now you
showing
can see the slides.
Second slide दिख रही है sir अभी?
Abhi, origin of the modern physical examination,
No,
No.
sir.
importance of clinical diagnosis.
You have start slideshow.
I made it on the slideshow only, sir. I made it slideshow. now.
Slideshow option.
Yeah, I have slideshow now.
Okay.
Now I can move the slides. Origin of the modern physical examination, nervous system.
You just stop sharing first.
Okay.
And I will start it.
Okay, fine. I'll do it now. Now you can see, sir.
Yes, sir. The origin of the modern physical examination.
This is origin of the modern physical examination. Can you see?
Yes, sir.
Now point number 13, nervous system.
No, sir. हाँ, sir.
Now you can see.
Yes, sir. Point number 13, nervous system.
Yeah. So shall I continue the same this thing? Are you able to see the slides? Because when I do this, this is it okay? Can
Yes,
you
sir.
see this slide?
Yes, sir. Point number 13.
Yep, nervous system. Okay, fine. So this is the, I again explain this particular slide where it is taken from the NCISM syllabus book where this explanation is available where how you should read the nervous system. So they have classified this and now in this slide you can see that term has been mentioned and marks is 14 marks, lecture hours 14 hours and non-lecture hours 4 hours. So uniquely they have made this kind of divisions so that we can concentrate more on which particular topic should be dealt on particular day. So I hope you are seeing the slides. I'll go to the next slide. I think it is visible, indications for a cranial nerve examination. Madam, is it visible? Shall I continue?
Sir, point number 13, nervous system. This
Ah.
slide.
Now it is there. Now you can see them.
Paralysis or paresis.
Yeah. Now I can, without slide sharing, I'll just explain three of them. I think you see this one slide.
Ah, yes. Indication for cranial nerve examination.
Yes. So this is, I think this slide is a bit clear that NCISM syllabus, what they have divided the entire nervous system and what are the points we should read it. Right. Now I'll go to the indications for the cranial nerve. So there is a specific conditions where you have to concentrate more on that. For example, what is the difference between the general examination and the clinical examination? Or which group of patients require cranial nerve examination specially? So looking at the symptoms, what we can see here, like head or facial or dorsal neck pain. So you can concentrate on this particular diagram where there's an angulation of the mouth can be seen, right? And second thing is there is fine tremors like altered movements, that involuntary movements or tremors or twitching of the facial muscles. In a general scenario, you can see when you go to the hospital, they are bit different. So maybe you can look that their hands or fingers are somewhat, they are having some kind of tremors, or maybe some of the patients are walking abnormally. That walking style, it is medically termed as a gait. The gait of a patient is not normal. So in such conditions, you can see that there must be some problem with the either cranial nerve or entire central nervous system is involved. So for such patients, you have to concentrate more so that individual cranial nerve can be established in the same patient. Coming to the next point, in which of the patients you have to examine like muscle tone or spasticity or rigidity. Maybe these terms are very new to you because you are still in the second term of the first BMS, but still you can notice that. Imagine a patient, or you just remember when you have saw the patient of paralysis. So you can look at that affected side, the muscles are not either, maybe a rigid can be seen, or there will be spasticity in the nature. Such patients require the clinical examination of cranial nerve. Next is about the balance or coordination. So there are some coordination not be there. Like if you look at, if you concentrate more on the just eating the part of that, or eating scenario of the patient where he can't able to hold it, the spoon, or he may not able to swallow properly. In such patients, you may require cranial nerve examination. Next, paralysis or paresis, or in common term, parsi or maybe hemiplegia. There you can find it. You can look at the uh, picture where the person is not normally looking, as well as he is not able to walk normally. In such patients, you require some kind of intervention from the cranial nerve. Next point will be a slurred speech, where in some patients, if you ask the name of the patient, that may be slurring of the speech may be there. So such patients require the cranial nerve examination. Next comes about paresthesia. It very technical term. In common term, you can see that the patient may complain of burning sensation, numbness, or the patient may not sensitize the pain. The patient will tell you, I'm not able to feel hot, I'm not able to feel cold. Certain sensory perception can be altered. So in such patients, you can see the you can examine the cranial nerve. Next is about hearing. Like some patients may tell you about, I may hear a very little. It is not related to age process, but still maybe the patient may complain of there may be a hearing loss, or maybe a partial hearing loss. Or in some patients, you can see the blurred vision. Patient will definitely tell you that I am not able to concentrate, I am not able to see one object. Instead of that, I am having two or three objects, or I am seeing the blurred object. Such patients require cranial nerve examination. Next is about the behavior or the confusion, or maybe a lethargy when the patient may not give you a proper answer. Example, in orientation of the patient, when you ask the name of the patient, he may tell you something else. So this kind of communication where the patient is not getting from your question, in such kind of patients, you may require the cranial nerve examination. And maybe in some patients where the sleep or wake cycles may be disturbed, or maybe a seizures. This is very important. I think you all maybe have seen that the condition of epilepsy or apasmara, where you can see some, there is an episode of little bit, maybe 1 minute, less than 1 minute, you will have some kind of episode of seizures. So that kind of patients definitely require cranial nerve examination. So these are the general or the rules where you need to concentrate more on the clinical examination as far as cranial nerves are concerned. Now I think, I hope you understood about, you have to separate the clinical presentations so that you can concentrate more on the cranial nerve. Okay, now after the introduction, I'll come to the cranial nerves. So these particular diagrams is easy for you to remember that the numbers what they have displayed. So they are the cranial nerve which are on the you can make your own type of animation, or maybe a kind of cartoons where you can remember this. So already you know that there are 12 pairs of cranial nerve. So basically they are named or numbered from the 1 to 12. So cranial or the Roman letters can be put from 1 to 12. So this diagram you can remember, so that at least during your examination time you can remember certain things, because definitely this topic or this cranial nerve is most important for the examination. Right. I think in this slide you can see that the names of the cranial nerve, like Roman letters and the name as well as the function. And such particular aspects in the entire anatomy syllabus, you can remember these mnemonics where this can be put, like only one of the two athletes were very good, victorious and healthy. So each first letter can be taken up of the name of the cranial nerve. So you can see olfactory, optic, oculomotor, trochlear, like that. And then you just concentrate more on that. So which function they does, like smell, sight. So this is how we can remember these things, by remembering the nerves, right? Now, one particular aspects where you need to highlight how these nerves are connected, how these cranial or the nerves to the cranium, the nerves which they connect to the brain. Otherwise, in other term, it is known as origin of the cranial nerve, origin of the cranial nerve. So I think you know the classification or the divisions of the brain, like cerebrum is there, cerebellum, and brain stem is there. So cranial nerve are related to these separate structures as an origin from the source. For example, you can see this cranial 1 and 2, they originate from the cerebrum or the forebrain, like that. And next, midbrain. Next is the brainstem structures like midbrain, pons, and medulla oblongata. So these are the divisions of the brain where individual cranial nerve will go and attach it. So just before that, I can tell you one particular aspect called as each cranial nerve have got nuclei. So there is a nuclei in the cerebrum or maybe in the brainstem. From there, one cranial nerve starts, and then it comes out, and then it goes to the respective organ or respective structure. So this is the scenario of the cranial nerve which attached to the brain. So what we have seen in here, that first and second cranial nerve are related to the cerebrum, and third to the 12th cranial nerve, they related to the brainstem. So that is midbrain pontine junction, pons, pontomedullary junction, and finally you have a medulla oblongata. So this is how these are attached. And this particular slide will show you some kind of openings, because cranial nerve is not only related to the brain, some of them they come out from the brain and they supply. So it is called as intracranial and extracranial course of the cranial nerve. So these are the openings. I think you hope in you might have seen in the library or bone library or museum where the skull bone, so one particular half sectioned skull bone will be there. You can see a lot of openings in that particular skull bone. So few of that openings may be related to the cranial nerve which they pass through from the openings, right? Now what you have understood about what is examination, or which set of patients you need to concentrate more on the cranial nerve examination, names of the cranial nerve, as well as their attachment to the brain. Now after knowing these things, we have to see that how these particular nerves are giving some kind of process or modalities. So they are divided into three basic things. Some of the cranial nerve are sensory, some of the cranial nerve are motor, or some of them are both. This is very important. Looking at that names of the cranial nerve also, you can remember these things. Now you have listed out 12 numbers. So out of 12 numbers, how much we have to, or how many are there in only related to sensory part, or which will give us sensation, and how many are there only doing the commands, only doing the motor activity, and some of the nerves which some fibers related to sensory and some fibers related to motor. As far as this cranial nerve are considered, these are very important: SSS, SVS, and SVM. What they are? SSS means senses derived from the sight, like your sensory organs, like from your eye, from your ear, or maybe a middle part of the ear or inner ear. So that sensation is important. Second thing is SVS is called as from your taste or olfaction. From there, these modalities of information will give transfer to the brain, and later we recognize the type of sensation. And finally, you have SVM called as from the pharyngeal arch. The muscles like your glossopharyngeal or maybe pharyngeal muscles, which are important. So every this somatic sensory, visceral sensory, they're all there. I think in your regular classes that can be explained about how which structure or which part of the body, what kind of the sensation or what kind of perception we are feeling, and we have to discriminate. I think example heart, you may have the difference between the looking at the object, like looking at the tea, which is hot, looking at the sun, you can understand the hot. So these kind of different modalities of sensation what the body can perceive. Okay, we'll go to the next slide. See, on this particular basis, again, the same 12 cranial nerve or 12 pair cranial nerve are again divided into modalities like S for sensory, M for motor, and B for both. If you put this idea in an individual cranial nerve functions, you have on one more mnemonics you can remember. Some of the which they start from S are olfactory, optic, clear, and vestibulocochlear. And some are motor purely like oculomotor, trochlear, abducens, as well as accessory and hypoglossal. And other one is the both. So what you have done is you have first listed out the name of the cranial nerve, next understood what kind of modalities that are taking place, and third part what you're doing is you're again dividing into which cranial nerve which function it does. Like olfactory, whether it is a sensory motor, it's a sensor. Like your vagus, it's a both. Some fibers will carry the sensation and some fibers will carry the motor fibers. So knowing these particular cranial nerve names locating in a different part of the body, and then you are seeing the different modalities of the functions of the nerve. So I think this is the basic scenario of the cranial nerve. So first you started with the cerebrum and the brainstem, then you have named the cranial nerve, and then you attach to the cranial nerve into the different part of the brain, and then you divide it into the physiology of that, which type of modalities they are giving us. And then again you divided the last sequence where some of them are sensory, like these 1 2 3 or maybe numerical value, they are sensory, the motor as well as both, right? Now I think I'll go to the individual cranial nerve. So further what you can have is first you will see the basic anatomy of that cranial nerve, and the further slide will be examination part. So this is, I'm not going to give you in detail about the these anatomical parts, because when your regular classes comes it will be dealt. As far as my topic is concerned, I will stress more on the examination part. So this is how the olfactory nerve is connected, located in the olfactory mucosa of the nose. Then it comes cribriform plate, and then dura mater, and then part of the cerebrum. So this is schematic diagram regarding first olfactory nerve. Now clinical examination. Once you understood the pathway of the uh, olfactory nerve, how best we can see that? In examination also you have two basic methods. One, anatomical variations, like try to examine the nostrils, both nostrils, where in some of the patients they are called as a polyps. I think it may be very new term to you, but you may heard that some patients may, or some of your relative, maybe some of the in the discussion you come across, he has some polyp, he had some kind of growth in his nose. So because of that the person is not able to smell properly. So that is one condition you have to look into the examination, whether his patency of the nostrils or the nasal way or nasal path, whether it is clear or you may have some kind of growth inside. So this is what anatomically or a structure what you can observe, because that may have some kind of implications in the act of smell. So then if this is quite normal, then ask the patient. It's a general examination what you can make it. Not necessary that you have to carry orange to the clinic, but at least some odor subject like spirit you can use, or maybe a the thick odorous substance you can take and ask the patient, closed one nostril, and ask the patient to inhale this thing. When the patient will tell you exactly the nature or the odor of that subject, that can establish the function of the cranial nerve. So function of the olfactory nerve. So then close that nostril and try it from the other nostril. So both you have to check whether the patient is making a normal or this particular object what you have shown. Better ask the patient to close his eyes so that you will have a very clear picture of olfaction. Clear? Okay, this complete about that. It's a rather very simple kind of cranial nerve, first cranial nerve examination. And coming to the second cranial nerve is optic nerve. As a rule, it's a purely sensory. This again, it has got a kind of detailed description of the pathways or the connections or so many things where I don't want to get into that. Many of you, as a common man or just a general knowledge of the optic nerve, optic nerve, optic, this common name comes. So only thing is, I'll just explain about the examination, because you have some temporal fibers, you have nasal fibers, all these things will come in case of pathways or optic nerve in detail, anatomical. So now only I explain about examination. How you have to examine in the, what is the process? So this is somewhat not directly related to the visual acuity. I think many of you have noticed about these things, where the if you happen to go to the ophthalmologist or optometry, where generally you have some kind of blurred vision, maybe the letters which are written in the board you are not able to see that, then you consult a particular doctor and there you can see he will give you, or he made you to sit in one corner and then he asks about the chart that's called as Snell's chart. So then you have to recognize the numbers or the letters, and then it goes on just minimizing, and then at one point you see that point is I am not able to see that. So generally that is done to see your refractive errors, refraction and refractive errors. This chart is used as far as refraction is concerned. If at all the patient is not able to read English or Kannada, maybe he has given some kind of objects where you can check that whether the patient having normal refraction or not. So this is related to, not in detail I'm telling you, so just a brief inclusion or a brief examination to see the vision of the patient. And this is also related to the another type of examination called as fundoscope or fundoscopic examination, or also called as ophthalmoscope. The one instrument where the doctor use, I think you can concentrate more on the picture on your right side. So see that first pupils will be dilated by putting some drops. Once the pupil is dilated, then doctor can see the abnormality or maybe some changes in the retina. So in your lower diagram, you can see the retina. So this is main part related to the nervous tissue. So this part is, I think many of you know that rods and cones. So they are all located here. So they are the basic receptors where they convey the kind of perception of vision. Okay. So these are the instruments what you use in case of second cranial nerve examination. They may give you some kind of information about the type of retina or related to your refractive errors. Right. Now we'll go to the third nerve called as oculomotor nerve. So the oculomotor nerve, the third cranial nerve, I think you might easy to understand this oculomotor. So oculo related to eye and motor is the function, the move. So now here on your first picture, you can see the nerve which is coming out from the brain stem, then how it connects to the muscles of the eyeball. I think some of you can know that there are total 6 muscles which they are required to move the eyeball. So these called as muscles of the eyeball. So on the help of that muscles, usually you are able to look from different angle from the your area. Second point, you can see this kind related to the entire movement of the eyeball. You can see only here the iris and the pupil. They're also very important. The next further slide explain about all these things. Clear? So because third, fourth, and sixth cranial nerve have similar type of examination. So some of them where one or two may not give you a proper understanding of the condition, but if you all this second and third, fourth, as well as sixth cranial nerve will give you a detailed description of the involvement of the nerve. So fourth is the trochlear nerve, and sixth is the abducens, where all these particular cranial nerve, third, fourth, and sixth, they are related to the one important aspect called as a reflex, pupillary light reflex. So there is a simple examination what you can do it. For example, you will have the accommodation reflex. So a simple examination is you have to take one particular pointed object. It may be a tip of a pen, or maybe a small stick-like structure, or maybe a very which is minor or small. So you start from the distance like 10 centimeters to 15 centimeters from the area. Then you have to go close to the face or close to the eyes of the patient and just concentrate more on the movement of the eyeball. See this particular patient you can see, or the person you can see, he is objecting on the tip of the pen. So you can see the movement of the eyeball towards one particular object. That is called as accommodation reflex. So what happens in case of patients whether they are involved in kind of injury to the cranial nerve? Look at the second diagram where the patient may not able to concentrate, or the patient is not able to see that particular tip when the affected side is involved. So the patient is not, rather is closing his eyes. This will give you a kind of involvement of this cranial nerve, which is not normal. So where you need to concentrate more on particular nerve, which is not making easy for the patient to see that top. And in the lower picture also you can see one particular eyeball is in one way directed and another is going towards the nasal part. So this is how it's called as accommodation reflexes to rule out the cranial nerve third, fourth, and sixth. This is more a detailed one. So before that, I will come to this nerve because almost it is similar examination. So sixth nerve is the abducens. See in this patient also you can see the patient is asked to follow a point with their eyes, commonly a tip of pen, without moving their head. So head should be still, and ask the patient to look at that object, and that object will be movable. Like you have to move in a H shape. H shape means you imagine how you write the H. First you draw from the top to bottom one line, and then you draw from the left to right. So this act will definitely give you the movement of from the top end to the lower as well as from right to the left. So this particular action of making H in front of the patient and concentrating, ask the patient to concentrate on that particular tip of that, so you can recognize the movement of the eyeball. Once it is affected, that eyeball is not able to move. So that concludes about the cranial nerve examination of third, fourth, and sixth. Now, bit complicated one or bit detailed one is called as trigeminal nerve. So as the name suggests, tri. So there are three basic divisions which will have the individual supply of nerve, where you can notice its functions. You can look at it here on your right diagram. You can see the trigeminal nerve were divided into ophthalmic, maxillary, and mandibular. So there are the three basic divisions where each nerve will have its own functions. Now we can go through the slides where three terminal branches of fifth cranial nerve innervate. Innervate means supply. They supply the skin, mucous membrane, and sinuses of the face. Air sinuses of the face. Motor division, I think it's a mixed nerve. Motor division, they supply to the muscles of the mastication I think muscle mastication means you're chewing, you're eating. So that particular muscles which they act on particular mastication, they are supplied by the one branch of the trigeminal nerve. So this anatomical course is very detailed. So I don't want to be continue that particular topic. And then we come to the examination part. How to check this? So how to check the cranial nerve fifth or the trigeminal nerve examination? Here you need to check in two ways. Because it's a mixed nerve, you have to check the sensation part as well as you have to check the motor part. Now what you have noticed is sensory part. So what you should do is ask the patient to close their eyes, gently touch the forehead because there are some branches are there, cheeks and the chin. Because previously you noted that there are three branches comes from the trigeminal nerve. So each will supply to the different part of the face. So ask the patient gently, you have to touch the patient with your own fingers. Ask the patient where I am touching. So patient will tell you about the exact location. And second thing is ensure to ask the patient to let you know if they are experiencing any changes in sensation. Some patients, if this nerve is involved, some patient may tell you about the different kind of sensation. If you are touching it, the patient may tell you it is pricking it. So like that, you have to elicit a different modalities of the touch what you are making on the surfaces in a three different regions. Motor function also be assessed. How to assess this? Simple thing is ask the patient to clench their teeth or ask the patient to show their teeth. I think you know the angulation of the mouth, how it becomes when you show the teeth. That angulation is most important, where because of the muscles of the mastication are supplied by the motor branch of the trigeminal nerve, whether the patient is able to do that act, or if able to do that, whether the both bilateral both angle of the mouth are normal or abnormal, that can be seen in case of motor part. Another examination what you can make it, ask the patient to blow, like you all imagine blowing of a balloon. So how you do that kind of action, you have to tell the patient to blow the balloon, so that you can see if it is normal, you can see both or bilaterally the particular the shape of that cheek will be normal. If it is involved, you can't find the affected side will not able to elicit that particular function. So this is how you're checking the trigeminal sensory as well as motor. After this, we'll come to the next cranial nerve is facial nerve. This is also a bit complicated, or it is also having both the fibers, the sensory as well as motor fibers. And this is also have got too much of pathways and too much of communications which are there. So instead of that, you just remember on this particular surface where easily you can notice the area which is related to the facial nerve. In this particular cadaveric picture, you can see where comes the cranial nerve of 7 or facial nerve. Then comes, you can divide it into different regions. So it is also a sensory as well as motor. So what it does, where it supplies, it applies to the facial expression. Like whatever you make, many kind of expressions on your face. So that particular expressions will definitely involved by the facial nerve. When I think you see that facial paralysis, I think some of you will notice that one side of the face will be somewhat deviated. In such patients, you can see the deviation of the nerve face or the muscles of the face because of facial nerve involvement. Now, this is the examination, what you can see on that. So the testing of the facial nerve involve assessment of muscles of the expression. So where first thing what you have to ask the patient, raise the brows. Eyebrows should be raised so that you can see the wrinkles on the surface of the forehead. So that is because that group of muscles are supplied by facial nerve. Then comes about closing of the eyes. So external you can see the, ask the patient to close their eye tightly so that you can see again the wrinkles should be formed on the surface of the orbital part. Next, blow out their cheeks. Ask the patient to blow and then check that muscles of mastications are working or not. And finally, you have the smile. So on the smile, you can see the angulation of the mouth on both sides quite normal. So this is without your involvement, you can also elicit, you can see in a patient. Next step is you have to put some kind of resistance. You have to put some pressure on that part. Like in your second image, you can see the examiner try to open his eyes. So that give you a kind of the motor activity, motor grip, or the normalcy of the motor nerve, which will resist your pressure. That will give you a clear cut idea of the facial nerve. And coming to that, because it's applied to the more areas, not only related to the face, but it can be seen, you can see in two diagrams where the one side of the face is not properly seen, or it is the kind of the features are not similar to the non-affected side. This is non-affected side and this is the affected side. So such looking at the patient, you can imagine that this facial nerve involved in the patient. Right. Next is about vestibulocochlear nerve. I think you have already the basic information about the inner ear. So we can divide it into vestibule, cochlea, saccule, atricle. So these are the some individual component in the internal ear. So this particular eighth cranial nerve called as vestibulocochlear nerve. The name itself suggests that it applies to the, or it related to the vestibule as well as cochlea of the inner ear. So you have two components. One is called as vestibular component, and another is the cochlear component. So vestibular component arises from the vestibular nuclei and cochlear from the ventral dorsal cochlear nuclei. So because it requires a detailed class with the facility of diagrams or maybe a projector where you can individually see these nerve in a bigger image so that you can understand. So how to check this? So this particular vestibulocochlear nerve examination, both cochlear as well as vestibular function. Cochlea and vestibule, I think you know the basic function of that. So how to assess this? First, as you have assessed in case of optic about the vision, same way you have to assess the kind of sound. You have to make just a kind of whispering sound in individual ear. First, you have to make in a right ear. You may spell some word or number like that, and then ask the patient whether he can hear normally, or he can hear the muffled sound, or he can hear a different kind of sound, or he may not hear at all about the sound what you have made. So this is, you have to check on both the ears. You just either you can tickle, or you may just make a small sound, or a piece of paper you can rub, or maybe a number you can speak. So this will give you a kind of hearing or the pathway which is normal or abnormal. This is a tricky one because when the age progresses, in case of 70 or 80-year-old, even though the cranial nerve is not involved, but generally the person will have a less audible output, so less words he can hear from the ear. So that thing, it is most important to elicit individual cranial nerve. So you have to separate it. It is not nerve or cranial nerve involvement, rather it is related to the audiometry, rather it is related to the hearing loss. And then comes about, I think many of you have noticed that Rennie's test and Weber's test. There is one particular iron rod is there, and then they will check bone conduction with the air conduction. Fine. Second component is the cochlear part, where you can see the cochlear part related to the hearing and vestibule part related to your balance. So when you ask the patient whether you have some kind of abnormality while walking, or you may feel some kind of noise in the ear, that will give you a kind of examination of this nerve. So I think you heard this fracture. So generally you will come across this common term like a fracture. Any bone which will get into this, any injury or maybe a fall, you will result into the fracture. So this is rather serious one called as the basilar skull fracture. So this image what you are seeing is called as the base of the brain or the cranial cavity. So you can see the skull bone here. So in case of majority of the accidents, majority of the incidents where this cranial, the skull bone may get fractured. So this is very serious condition where you can come across because of this injury or the fracture, you may get into a lot of conditions, especially called as CSF otorrhea or CSF rhinorrhea. The CSF, you already know that, cerebrospinal fluid, which is circulating in the meningeal fold. It is required to nourish the brain tissue. So because of these fractures, one of these openings, because of fracture, the bone will break out. So because of that breaking, the passage is made, through that you will get the CSF which is coming out from that condition. So this is rather very serious condition where you come across this nerve is involved in that. So basically this vestibulocochlear nerve can be damaged within the internal acoustic meatus. So you can see the ear, if you imagine, you will have external ear, middle ear and the internal ear. So during this you will have one particular petrous part of the bone, which is where once it gets fractured, you will have involvement of this kind of, particularly the vestibulocochlear. Not only related to this nerve, other nerve also damages in case of fracture. Next cranial nerve is glossopharyngeal nerve. Same thing, glossus as well as pharynx. It's applied to the both regions like the tongue as well as the pharyngeal muscles. It is also a kind of mixed nerve, a sensory as well as motor nerve. So because this, the name you can divide it, glossus is a tongue, pharynx is the another part. So it applies to the glosso as well as pharyngeal part of the body. So these are the course of the nerve. Then examination of this. How to examine this particular, because this is not only related to the glossopharyngeal, but some fibers of the vagus also involved. So how to check that? Simple thing, ask the patient to open the mouth wide and say ah. So you have to ask the patient to sound loudly about ah, so that you can see the inner, the cavity, oral cavity proper, as well as the pharyngeal, oropharynx, right? Oropharynx, we can see that there's a vula as well as there are the folds which they move on seeing these particular action, or the posterior pharyngeal wall. The posterior pharyngeal wall supplied by the vagus and the this nerve. You can make the movement of that. So soft palate should be moved upward centrally, and testing the gag reflex should be performed unless bulbar impairment is suspected. Fine. So there's a different issue where simple examination. You have to take a tongue or the depressor. You have to depress the tongue and see that the oral mucosa, and ask the patient to say ha, so that you can see the movement of the pharyngeal cavity. And coming to the most complicated and most, the name itself, vagus. In Latin, vagus means wandering. This nerve will have so much of communication, so much of supply to majority structures of the body. So it's a very detailed one. Rather than this diagram can be easily understood about, this vagus is required for the larynx, then the vagus is required for the diaphragm, lungs, heart, esophagus, stomach, intestine, as well as the colon. So this have huge communication to each part of the different systems like GI system, respiratory system, as well as the part of endocrine system also involved in this kind of vagus nerve. So see, these are the different supply in the neck, in the thorax, and in the abdomen. So this is how the vagus is a very lengthy one. It supplied most of the structures. So coming back to this examination, typically evaluated conjunction with the glossopharyngeal nerve. Previously, what we have noticed, the glossopharyngeal examination also comes about only related to the pharyngeal part. And then comes about voice. This, ask the patient to tell his name, ask the patient to just sing a particular word, spell a particular word, so that the word is the speech, what you can, it is normal or it is hoarse or abnormal. So these particular sounds can be also give you some kind of involvement of vagus nerve, right? And then simple examinations about swallowing. So give a sip of water to the patient, and then you ask it to swallow that, whether the patient is able to swallow properly or not. That's also one examination related to vagus nerve. And coming to the accessory nerve, you can see this rather smaller one. These last two nerves are smaller one. It's supplied to the, I think you might have started the dissection where you might have seen the sternocleidomastoid part of that or trapezius muscle that supplies to the muscles of the back. So I think few muscles are important like levator scapulae or rhomboides or maybe major and minor and trapezius. So they are the muscles, and this is how you have to elicit. Look at the diagram where ask the patient to shrug his shoulder, ask the patient to make that kind of movement, and then examiner should press this down. Examiner should press this down against the resistance. So this will give you a kind of involvement of this particular nerve. And see the muscle bulk or the muscle size, whether bilateral you can see the shape or the contour of the muscle is normal or abnormal. That can give you a kind of the involvement of this particular cranial nerve. Next is called as the muscle power by gently trying to overpower the contraction. You just gently on the surface, you have to put pressure and ask the patient to again shrug so that that moment when your palm can notice that kind of resistance while making that movement. That will give you a kind of involvement of the nerve. Second patient is turning the head. Ask the patient to turn head to the right or to the left, and then you have to put your hand against that particular movement so that when the patient is involving this cranial nerve, he may not able to resist your pressure. So this is how a clear-cut examination of the muscle movements related to this cranial nerve. And finally, you have the hypoglossal, hypoglossal. So this is also important, where the hypo is under, the glossal means the tongue. So this particular nerve is involved to supply the regions below the tongue. So this is the anatomical course. You can see the a single nerve. Then it's applied to the lower regions of the tongue. And finally, you come a point where how to examine this particular hypoglossal nerve. So the hypoglossal nerve, it protruding tongue. So you can make a lot of movements. So ask the patient to protrude, ask the patient to protrude the tongue so that the moment first you have to observe that, and then you may see that some deviation, whether the tongue is right or left deviated, it may give you some kind of involvement of this particular nerve, hypoglossal nerve palsy. For example, hypoglossal nerve is relatively uncommon cranial palsy. Generally, you don't get these kind of involvement. But in case of malignancy or in case of any other condition which will involve this nerve, it will result into the injury. So what happens? Patients will present with a deviation of the tongue towards the damaged side. If the right side or the right tumor or maybe right-sided part which is compressing that nerve, the patient is that sided, tongue will be deviated. And then the patient will have a fasciculation or the twitching sensation of the fibers can be seen. Right. So before coming to the conclusion, I just refresh, I just go through the individual, the cranial nerve, what we have finished. So you started with the Roman numerical numbers, and then initially you have noted that what is cranial nerve, and basically what is examination, and second thing is what are the names of the anatomical names of the cranial nerve. Then you involve into the or next part you connected with the physiology or the modalities of these individual nerve. Then again you divided into three divisions, like how many are there which are important for us to give a sensation or a perception, and which group of nerve which will only act on the particular region like making a movement or the motor part, or some of the nerve which will carry both the functions. Then individually you started with the one cranial nerve. So in the first related to optic, you noticed about the vision, and for first one is olfactory where smell, second optic, and third, fourth, sixth are related to your eye. And next comes about the face, clear, and then comes about the major trigeminal, facial, vagus. These three are mixed nerve, very complicated nerve, and individual examinations you have noted. And after going through this, you need to be perfect in eliciting these things. In first examination, you may not assess these things unless you are thorough with the pathway, you are thorough with the conditions where, especially you might have heard that in case of ICUs or maybe in case of the road traffic accidents, in case of severe head injuries, this particular examination can be easily assessed. So coming to that, my conclusive slide, wherein Charaka explained in Sharirasthana, where Sharira Sankhya Yo Veda Sarva Veshobhishak Tat Jnanam Iti Mittena Mohyana Yujyate. So you need to have a clear cut knowledge about the Sankhya, about the nature, about the shape, about the location of the organs, so that you will have a clear cut knowledge. As well as Sushruta mentioned in Shareera, Sankhya Sharirasthana, the chapter where Sharire Chaiva Shastre Chaiva Sat Visharadaha Drishtashutabhyam Sandeha. So you need to go through the Drishtartha, that is Drishtartha Shadvisharada, means that is the fun of or the requirement of going through the dissection. Going through the dissection, seeing the object, seeing the organs, and feeling the touch of the organ, you will get to know that how these particular nerves or how these structures are capable carrying the functions. And finally, you have Shariram Sarvata Sarva Sarvada Veda Yobhijak. So last sentence in Sharirasthana Acharya told about, if you want to give a treatment properly, so you need to go through these particular subjects individually, theoretically as well as practically, so that your treatment will become successful. So just before going to end my speech, I just refresh some points, because it is yesterday only we had a meeting in the NCISM Rachana department people, and there we have discussed more points related to the one heading what they have made is early clinical exposure. Early clinical exposure, where the first year students are made to go to the hospital and they have to see patient. From the patient part or from the patient side, they have to assess their anatomy. So for example, you are seeing a particular fractured arm, you have to imagine the bone may be fractured. So like that, it's rather in a different way or in maybe a reciprocal way that you are understanding anatomy subjects with the help of presentations, with the help of patient presentations. So that is very crucial, and they have meant some 8 hours of time in a year, so that you get into that kind of activities or the exercises where you see the patient, you observe the patient, you just know the different know the presentations of the patient, which patient require which system examination. That kind of activity will definitely help you in the part of anatomy, because in examination only the cranial nerve may be asked and you are able to write it. But when you come into the practical part, or when you go and start the practice, you have to be very clear with these basic anatomy and physiology, what you read in first year only. From the second year onwards, it's applied, or it's maybe different altogether it starts. So you need to go through from the beginning. So by saying these things, again, I thank all the organizers who have given me the opportunity to just give away the talk on the cranial nerve examination. Thank you, madam. Thank you, one and all. And
Thank
regarding
you.
any questions,
Yes.
and I'll be very happy to take the questions.
Yes. Any questions for this session? Right.
One question from Atifa.
Okay.
Sir, you said about movements of muscle in the affected glossopharyngeal nerve. How is that movement? Can you elaborate?
Glossopharyngeal nerve.
Yeah.
Okay. Fine. You have to divide it. Can I audible? No. You can hear my voice.
Yes, sir.
Okay. See, I just go through that slide. So again, I can repeat only that part. Okay. Can you see this slide now?
No, sir.
Sir,
Yeah.
please share again.
Yeah, I'm doing. because without diagram, it is not properly clear. So I'll just again share it. Okay.
Yes.
Now it is, I think, seen.
Yes.
Glossopharyngeal nerve. Is it visible?
Yes, sir.
Yep. See there, first is it's a mixed sensory as well as motor. So sensory to the oropharynx, carotid sinus, and the posterior. Motor is to the stylopharyngeus muscles of the pharynx. See, this is bit. I know that first year BMS, it's very difficult to see that. So first is cuffing reflex, or looking at the oral part. I think pharyngeal part has been taken place. I think it is in the first term, GI tract. So where you divided into oral cavity proper, and then esophagus or the pharynx, you are divided into oropharynx and nasopharynx, oropharynx, and the laryngopharynx. So these are the divisions of the pharynx. So this glossopharyngeal nerve supply to the different part of the pharynx. One of the examination is the palate. I think first you just tap it on the surface called as the hard palate. So if you go beyond that, you will have the soft palate. So that soft palate is called as the gag reflex, the testing of the gag reflex. Gag reflex is, I think, once you put your hand into that, you will have a sensation of vomiting. Is it right? That's called the gag reflex. So maybe you might have seen that. Usually some patients will intentionally do that. So that's what, if you put more pressure on the back of the tongue, you will have a signs of regurgitation. So that is how the glossopharyngeal nerve as well as vagus. So this is very clear. Make a point that this examination what you're making on this particular topic is mixed vagus as well as glossopharyngeal. Okay, you are not separating vagus separately or glossopharyngeal. So this one examination is see the oral cavity, ask the patient to make movement or say ha, so that you will see the movement of the palate, or the uvular movement can be seen, or the constrictions of the muscles of the pharynx can be seen. I think in pharynx you notice that extrinsic and intrinsic kind of muscles will come. Tongue also it will come. So there the muscles or the motor part can be seen. So if you go through this, see, taste sensation, 1/3 of the tongue, and parasympathetic nervation to the parotid gland as well as muscles of stylopharyngeus. So this particular muscle can see in this, that can be elicited. I hope I answered the question. Any questions?
Hello,
Yes, please.
am I audible?
Yes, madam.
Myself, Dr. Ashwini.
Yes.
No, actually, I'm not asking the doubts. Actually, I just want to acknowledge Dr. Prahlad sir, because I'm a student of Dr. Prahlad sir last 12 years back. I just want to feel my acknowledgement for the sir, so that when I was in a student, the same feeling I felt today. Incidentally, I attended the seminar today. Even I am in a clinic, but could not completely attend the webinar. But I'm much happy about the sir, and I just want to congratulate sir for this event.
Thank you, madam.
Any question from delegates? Okay, it seems our delegates are very happy to listen your enlightened speech. The topic was such a difficult, but you expressed in a very simplified way. So I thank you, Dr. Subbanwal sir. Thank you very much. Thank you, Dr. Madhuri ma'am. So let us move to our second session. Now I request Dr. Rubia ma'am, Assistant Professor, Shareer Rachana Department, Dr. N.A. Magdum Ayurvedic Medical College, to introduce our next guest speaker, Dr. Harshavardhan sir, and start the second session.
Thank you, Pallavi ma'am. Good morning, all faculty members and dear students. It's a great pleasure to introduce our today's guest speaker, Dr. Harshavardhan V. Balihar, Professor and HOD, Department of PG Studies in Shareera Rachana at Rajiv Gandhi Education Society, Ayurvedic Medical College, Roan. Sir will be speaking about the paper writing skills and time management. Writing is a primary basis upon which one's learning and intellect will be judged. This is the subject where we should give our utmost interest so that we will achieve better results in exam. Also, it will prevent you from panicking during exams. Dr. Harshavardhan sir is graduated from Government Ayurvedic Medical College, Bangalore in 2004. He completed his post-graduation from Department of Shareera Rachana, SDM College of Udupi in 2010. Sir has 12 years teaching experience. Sir has set Shareera Rachana question paper for BAMS in Rajiv Gandhi University of Health Sciences for 3 times. Sir has been guide to 5 PG scholars, and he is a reviewer of Grant's Atlas of Anatomy Asian edition, which provides ideal view for human anatomy. A YouTube channel is run by Sir called Harsha's Anatomy for immense anatomical knowledge. Sir also has a Telegram channel called Shareera Rachana, where the practical anatomy is made so effortless to understand. The e-books, lecture videos, links are really advantageous and informative, not only for BAMS but for all the subjects of BAMS. Now I heartily welcome Dr. Harshavardhan sir for his informative session. Thank you, sir. Welcome, sir.
Thank you, ma'am. Thank you so much. Thank you, everybody there, and I respected President Dr. M.N. Magdum sir, Principal sir, and HOD Pallavi Kulkarni madam, and staff, and the students who are listening to this webinar. So, my topic is about the time management and study skills related and how to answer in the examination. So I'm going to share the PPT for 2 seconds. We'll share the screen so that I can open up the
Sir, you are operating from tablet.
from mobile, sir.
So close your camera first. Then start sharing.
Okay, close camera. Sir, I could not share it. I don't know. To this, the topic is how to write answer in exam and how to manage time. Myself, Dr. Harshvardhan, Professor and HOD in RGES Ayurvedic Medical College, Roan. So next slide. Can I do that one? No. Okay. By looking at this slide, you may understand that what are the process. See, when we start studying, no, and as we admitted in a first year BMS after our 12th standard, suddenly we will go with two heavy books of anatomy like BD Chaurasya or Vishram Singh, anything, and some topic will be dealt to us, and we started to read the subject from them. First thing what we do is started preparing without knowing the subject at all. That is major thing where we fail in a Rachana preparation or anatomy preparation. So first, whatever topic we study, that has to be short. First one is very gross level. In the short term preparation should be there, where the gross study with the terminology and understanding. Without understanding the terminology, it is very difficult to understand the anatomy subject. So first understand whatever the terminologies are there, at least not in detail, at least very short terminology and main terminologies should be known. Then once we are known with the short term study, for example, we are studying about stomach, we should know what is there in the topic of stomach, not in detail about stomach. Once we understand what main content of the stomach is, then we will go with the long term, means long studies of each individual details we should go with. Means what are the subheadings are there in the topic given, like in stomach you are reading, there should be definition, there should be a location, there is external features, many things are there, blood supply, venous drainage, nerve supply, little bit details should be studied first, then analysis of the subject. First, next we have to do the analysis. This is the topic, it is there, whole subject it is there, how much I need, that has to be understood. See, one thing all students should understand, that what book author has been written is by his experience of 50 years or 60 years. And whatever he know, he have put into the form of a textbook knowledge. And being a first year BMS students, it is not possible to understand each and every sentence in the form of how author says for that one. So it is impossible for any BMS students to understand each and every paragraph of the textbook. You keep in. And according to my experience, I will tell you that if you understand 20% of the textbook, whatever it is there in the textbook, it's a brilliant thing, whatever you can go with that one. Right? So be happy that if you are not understanding something, you are normal. And if you are understanding each and every sentence, whatever it is there in the book, you are brilliant enough. I don't have words for that. Next is, after understanding all subject, next we should know what is the purpose and preparation of study. Next, why you want? There are two purposes are there. One is a knowledge purpose and another one is exam purpose. For what purpose you want to study that topic, that is left to you. Again, So go with the first is about the knowledge purpose. You understood about the knowledge, that's what I will tell. If you understand about 20% of the subject, it is there in the textbook, it's good enough. Or 30% is very fine. Then you are studying for the examination purpose, then for the that is something different level, which we are going to understand in the next coming slides. Next, we will come to the preparation of the notes. See, knowledge does not have any boundings. It will be limitless. Writing the notes for the knowledge purpose is no use. But notes preparation is only for the examination purpose. Knowledge purpose do not make any notes. Book itself is very less for the knowledge purpose. Okay, so preparation of the notes should be only for the examination. Then think about what you need for the examination and prepare well for that one. Okay, so please next slide. Now, before entering this main thing, so how to write answers in exam? Main question of BMS students whenever I come to the classroom and I will teach students for a whole year, and before examination, this question will be asked by the students, how to answer in exam. Main problem by the students, they did not have any idea how to write in a professional college. It's not only in a BMS, I will tell you this will be the same scenario even in MBBS and any other professional courses. So you are not only one person who is not understanding it. Many people does not know how to write exam answers in examination, and many colleges, the teachers also, they do not tell the students that what are the things are there in the component of the exam. See, for this topic, how to write in examination, you need to know four main things. What is exam? You should understand what is exam, and what is answer, and what is marks, and what is time. See, if you understand these four things, I hope you will understand how to write answers in exam. We'll go one by one. So next slide. See, what is exam? Exam is the one thing which has a time-bounded test. About 3 hours time will be there. And there will be long essay questions, short essay questions, and MCQ. Within 3 hours, you have to write. These three components which are there in your hand, right? And evaluation and results will be there, which is, we don't have any rights over this part. Evaluation also, you don't have, and a result also, it's not in your hand. Only thing which is in your hand is about your time and question answering. And the questions are three types: long essay type, short essay type, and MCQ. So this is what exam time bonded. 3 hours. Within 3 hours, you have to write it. Okay, this is about the exam part. Then what is answer? So answer is a presentation of the question asked, right? Whatever question asked, you have to present the answer. Simple and clear explanation should be there, and your answer should be easy and understandable way, and visual understanding than the reading. See, this is one where I will come to the evaluator point of view later. Many people will write the answer so that evaluator has to read your answer thoroughly, then he has to give the evaluation. And every student will expect this one, that every evaluator will read your answer. It is not possible, because evaluator will evaluate your paper within 4 minutes, and you have taken time to write the same answer for 3 hours. Within 4 minutes, we cannot read 52 pages, whatever you have written. So major thing is, more than the reading, we will go with the visual thing. No, whatever you have written, we will see it. So your answer should be more visual than the reading. So concentrate on this one, which I will discuss it later again. And write in a point by point pattern. See, you are writing in the paragraph way. So many evaluators will think that how much point he has written, how much subheadings you have mentioned. Okay, that may be the one of the thing where the evaluators will give marks. So make evaluator easy to count how much point you have mentioned in the examination paper. Okay, so point by point. Many people will use star mark. Some people will use arrow mark. Rather than that, you can use the numbers only, so that he can understand how many points you have written. So some evaluators will see about the points, even it will be good for them. Then what is marks? Marks is a mean evaluation of 2 or 3 evaluations. Okay, there are 2 people who are going to evaluate your paper, and till now the highest marks were given. Till now the mean marks were given among 2 evaluations. If difference of 15 marks will be there, then it will go to the third evaluation. Then the mean of 3 will be given as your marks. So whatever marks you will get in examination was not actually your marks. It is a mean marks of 2 or 3 evaluations. So this time actually the 2 evaluations will be conducted, and the highest evaluated marks will be given. That order is there. This time we'll see from this NCSM batch how this is going to implement. Till now, it was about the mean evaluation of 2 or 3 evaluation. From your batch, it may be highest marks allotted by the evaluator will be given as a final marks. That is going to help students to easily pass from the examination also. So all over assessment of your answer will be allotted. See, many students will tell that, sir, I have written everything. They don't tell that I have written this one and this one. They will tell everything. And the answer of the marks will be allotted for your answer only as an assessment, total assessment. They will look at your answer, and out of 5 marks, how much marks I will give. That will be there. Rather than counting, what is the next is about the structure allotment of marks will not be there. For definition, this much marks. For the explanation, this much marks. For the conclusion, this much marks is there. Not in BMS till now. There is no structural marks allotment system is there, which is there in your 12th standard or POC. There will be a structured answers allotment will be there, but in BMS, it is all over assessment of your marks will be given. And as you know, theory 50% marks you have to score, and practical 50 marks you have to score. Next. Sir, next slide. Okay. What is the time? See, always remember there will be 3 hours time bonded. This is main thing. See, we study for the examination, we prepare examination, but without practicing time bonded material, time bonded practice we will not do. So when we enter in examination, only time matter will come, or else whenever you are studying in the room or in a hostel or in a library or practicing the answer, we do not consider time as a main thing, but actually main thing is about the time. Because when you have heard about, many students will come to you after the examination, or many students will go to the teachers telling that time salila madam, I could हमें time 3 hours बहुत कम पड़ रहा है, तो हम पूरा नहीं लिख पाए जितना हम जानते थे. So that will happen because we do not concentrate on the time. So time factor is a main thing. Within that time we have to practice, which till now we did not do. Including me, from first standard to the BMS, I did not practice in time. That's why the problem is main problem is there. Okay, so next. Okay. Before examination, we should have preparations, right? Preparation should be there. Without preparation, we cannot handle the examination, isn't it? There are 2 types of preparation are there. One is mental preparation, and another one is a physical preparation. What is a physical preparation here? We'll see one thing. Mental preparation, next slide. Next slide. Okay. See, in mental preparation is self-guided attitude towards subject. Okay. See, daring to dream. Self-guided means you have to guide yourself for the examination preparation. That self-guided and that interest and that concentration, usually, as I know, student will get that preparation mentality when examination is announced. Before announcement of examination, no one worries about the examination. So you have to guide yourself from the day one daily for the preparation of the exam. And attitude towards subject. See, some people will tell that anatomy is very difficult, Kriya is very easy, Sanskrit is difficult, Ashtanga Hridaya is again difficult, Padartha Jnana is even more difficult. If you start telling this word difficult, difficult daily, and if it is there in your mind, then how to read about the subject? You have decided the subject is difficult. That is a main problem. So change your attitude towards the subject. See the subject as subject, not as a difficult subject or easy subject. It is a subject, that's it. And the question will come from the subject, and I should know, and I should see the syllabus and see the previous question papers, how questions are going to come. According to that, how to write the answer and how much marks that will come. That is a discussion. Here about fear factor of the subject should not be there. You change the attitude towards the subject is the main thing. And dare to dream, what is there in that? Okay, you need not to pay anything. Dare to dream. Okay, I will do best in the Rachana Shareera this time in the whole Karnataka. I will get the good number of the, and I will get 80%, 90% this time. Definitely, it is possible. Man. Dream. Even there's nothing bad in dreaming. No, we do not have to pay anything about the dreaming big about the examination and the result. It's good, dream good, and do not get feared. You pass others, though that attitude should not be there. Okay, so dream good that I will definitely do this. It is possible. Anyhow, till now, no one stayed in the exam. Everybody passed. I can also pass, and I can score even better than the previous batch. I can do that one. Dare some big things. Okay, this is how your mental preparation for the examination should be there. Next. And physical preparation. See, in physical preparation, main thing is about the food study and exercise, which many students will very much neglect these factors. Okay, food will play main role supplying source of energy for your preparation of examination. It may be a physical or mental, right? And study also. Okay, and exercise will definitely give some very good result in examination, which I will discuss later. Food which is there in a regular time and exam time, that will depend, which everybody knows. Many people are staying in hostel. They don't like hostel food. They always want to eat junk food outside, gobi manchuri, pani puri and all. If it is there in a regular time, it is somewhat okay, but not good also, but it's okay. But in exam time also you do the same thing. If you feel unwell, then what about the exam? Then how you will write good exam preparation? So always concentrate on the food factor also. Food will play major role or important as equal role in a preparation of the examination. Some food will also enhance your memory also. So such nutrition proteinous food you have to take, and it is possible. If sometime I will tell you what type of food we can manage in the hostel life, that we can discuss in some other topic, but not today. Study is there. This is one important, and many people will think that study is a physical preparation. How it will be? It's a mental. No, it is a physical preparation. During exam and during knowledge related study, that will I will discuss later. Exam related study is something different than the knowledge related study. A regular time you go with the knowledge related study, but as exam are coming near, exam related study have to be shifted. Always knowledge related study will not give the good result. Always exam related study will not the good result. You have to manage both. Exercise is also very important. Many students will not do this one. I will suggest to students, especially girls of the BMS, once they enter the hostel, they will come out only many hostels. They will come to the city only weekly once, that to 1 hour or 2 hour. I have seen many colleges doing that one. But you have many other options doing exercise being in hostel. 1 hour daily exercise is mandatory for the students even during examination. Do not skip. Exercise means you need not to go to the gym or something, anything. You can walk, you can do cycling, you can play badminton in your hostel with friends, do some physical exercise, or you can do some simple stretching, yoga you can do pranayama, you can do many things in the physical exercise, which will give you very good result, as 1 hour exercise is always good as equal to the 1 hour of your any subject study. Okay, so do not neglect exercise part during examination and daily life. Okay? Good results will include, best result will be a combination of a study for the knowledge and study for the exam. Both I have discussed. And once you do this one, that I will come to what is the study for the knowledge and study for the examination part. I will discuss it later. And after that one, we need to practice. See, when you can see that animation, no, which is going on, then I don't know who is that player, but still, what is that actually? It is a net practice. It's not a real match, right? He is practicing how to play in the game. Final real match, right? And everybody, whoever is a singer in your group, when there is a competition of singing, you will practice in your room about the singing, or someone will be practicing about the dancing. Some practice neck practice for the cricket or football. Many things are there. But in as exam comes, everybody will start reading it. See, in exam, you are going to write the answers. You are going to write the answer and you don't practice it. You just read it and you will tell that I know this answer. And one directly will practice in the examination hall only. Why that blunder many students will do, I don't know. So when you are going to write in time bonding, time bonded writing will be there in the examination. You have to do the same net practice in your room within 5 minutes or within 10 minutes. If it is a 5 marks question, how much to write, what to write, that net practice has to be done. Then only the best result is possible. If you are reading, how much you know the knowledge about the subject, how much you know how to write the answer in the examination. But if you do not practice, your hand are going to shake in examination, handwriting will be failed, and you are going to lose the confidence, and you cannot write the best answer, and your best result will not be possible. So always practice the answers, how you write the exam in the examination. Okay, time bonded practice should be done in the room only before the exam. Next slide. Right. Then preparation for the long essays, short essays, and MCQ. See, there is one thing you always remember. Question is there as an essay, then you are writing the answer. How you have, I know that every student has one or other day you have written about the essay on one topic. When essays are asked, there should be some rules for the essay. No, there should be introduction part, there should be description part, there should be a summary or conclusion part should be there. Students will write whatever it is there in the question and how much they know they have written, and they will think that whatever question is asked, I have written it and I will get complete marks. They expect, for example, question is there for one, if I take lever is explain lever, this is a question, and they will write about they whatever they know about lever, they will write it, and they will think that ah, I have written the answer, then I will definitely get 5 marks out of it. And in the evaluator will some evaluator will give 3 marks, some will give 2.5, and some may give 2 marks, and total result will come in a 50 marks. Then there will be a problem. So think about what to write for the preparation of essay for 10 marks, preparation of essay for 5 marks, and for the MCQ. For MCQ, this is very new to you. There is, I don't know to explain how to prepare for MCQ. There is 10 rules are there how to prepare the MCQ. If you follow one of my video content is there in my YouTube channel where I have elaborately explained what should concentrate for MCQ type of questions. Okay, for example, 1 or 2 points I will discuss here. I will not waste your time here to discuss everything. You can go to the I can provide some links how to prepare for MCQ type of questions. It is there already in a recorded form in the YouTube. You can follow there. For example, if MCQ is a one word and a reference based questions are there, they cannot ask vague questions. For example, Charaka Samhita is written by, or Sushruta Samhita Shareera Sthana contain how many chapters? Or Marma according to Sushruta Shareera Sthana explain in which chapter? Like that, they will going to come particularly pinpointed explanation will be there. And many points are there. You are going to understand it later. If I start telling about MCQ, it will take another 1 hour for explanation of that one. The preparation should be there wherever you will find one word answers and reference based answer underlying with the different colors. Then you will understand about this might be the important question for your MCQ. You are going to understand it later as we also has to see upcoming NCISM new question paper and MCQ pattern, how who are the question paper setter and what is their mentality and how they are asking. On that basis also we can discuss it later. And same thing about the once you prepare for the answer of essay, then practice it. Practice your answers and later analyze and give marks for your practiced answer by yourself. You will understand how much marks you are going to give to the prepared practiced answers. Okay, then you will understand, oh, I have to write this one, I have left out this one, that like that you will understand it. Next slide. This is one thing which is very important. Every student should know this one. Psychological preparation of psychology behind the evaluation. Okay, you need to know. See, there is a saying, no, if you want to find the donkey and think like a donkey. So think evaluators are donkeys and they are how they are giving the marks, that you have to understand. Psychology behind evaluation. Look, if you are evaluating out of some marks, first thing what you do, you will think how to cut the marks initially. Okay, once you do not find anything to find how to cut the marks, you are going to impressed by the answer, then the evaluator will think how to give the marks. Okay, and evaluator have some limitation for themselves, and that's why they will give a safer side evaluation. For example, you have written very beautiful answer and evaluator want to give 5 out of 5, but he won't. He will give 4 or 3.5 because till now it was there. If second evaluation also it will come 15 mark difference, then it will go to the third evaluation. And evaluator does not know that whether he is evaluating third evaluation or first or second. And if it is found aggressively low marks giver and high marks giver, then the university will note and ask the evaluator for the explanation. So evaluator will also not go for the risky marks giving. He will be very safe. Evaluator will be there. So it is not possible to expect the expected marks by the evaluation. This thinking you should know. Then about think like an evaluator. See, students should know this fact that each and every evaluator will evaluate 40 papers per day and with other regular works in the college. Remember, he has to do all other works. Along with that, he has to do 40 papers per day. And if he don't want, he can leave no, because there will be 100 rupees per paper evaluation. He won't leave this option of earning the thing. And think about both work management, his stress level during the evaluation. Okay, so this is how the evaluation will go on. And your paper will be among these 40 in every day. And many people, this is the fact in a Rachana paper evaluation that this is my personal experience. Among 10 papers, there will be 1 or 2 good paper will be there. And I'm not telling about the others. I will be seeing, I will be very desperate to see good answer paper. You believe it or not, once among the 10 paper, 1 paper will I find this is a very good paper, and so that will make the evaluator dopamine very high that he will give as maximum marks he can give. Even for the not good answer, if you are written no, for that also he will give the marks, like that it will happen. So your answer paper should be one of that desperate good answer paper evaluator are expecting. This is only happens in Rachana, not in other, because every in Kriya and other papers, everybody has written because it's an easy paper and everybody interested in writing. But Rachana paper, no, evaluator will not get a good answer paper in among 40 per day. 1 or 2 paper he will get. If your answer paper is that desperate good answer paper, you believe it or not, your answer will be more than whatever your expectation. So your answer should be very different from others, that you have to keep in mind. Okay, next is about, this is one thing which I came across about the students that, sir, my knowing your strong and weak areas. Know your strong and weak areas. Like some people will be very good, understand, they are very knowledgeable person, but their handwriting is very poor. Such students are there. And presentation skill they do not have, though they have good knowledge about the subject, they are very regular, very studious, but their presentation skill is not at all good. And drawing, forget about the drawing. If I ask you many people to draw the humerus, they will draw the pillar, literally the wall pillar they will draw. So like that, they are going to draw that. And shloka writing with references, they will forget it. Many people will ask this question, see, why to by heart shloka? Tomorrow we are become a doctors, and if I tell, if the patient will come in front of and sit, and if I bring a treatment, I will, if I tell the shloka, you will understand why to by heart it. So this is a main controversial question which is there. So it is depend on the student. If see, marks given by evaluator and maximum evaluator till today I know they expect shlokas in the form of answers. In the answer, you have to write the shloka, then they will give the marks. Then it is the thing, then you need to by heart shloka. If you do not write it, they won't give the marks. So it is a need of the time. You need to by heart shloka and write at least some important shloka which you need to write. I'm not asking all shloka you need to by heart. The shloka which are going to come very easy to by heart and which can be used, which are going to come in a second year or third year or in the fourth year. For such shloka you need to by heart. There are some important shloka in Rachana Shareera which may not come in a second year, third year. For example, if I take Marma Shloka or Shareera Shodhana Shloka, they are important for the first year, but they do not come in the second year and third year and fourth year. But in the same way, Srotas Shloka, they will come first year also, second year in Kriya also, in Sagrudya also, again in Charaka, again in many other subjects. Okay, so what is the bad thing if you by heart shloka? You think that they are going to come in the next coming years and it's going to help you to reduce the burden of next coming year, you by heart the shloka. And it is dependent on. So here, what I'm speaking is, oh, so what if I have a bad handwriting and I'm a good student? I know the knowledge, but my handwriting is very poor, whether I will get good marks or not. This is a question which my student will come and ask me. Definitely you are going to have a good answer, good marks, though you do not have a good handwriting. Good handwriting, I will come to this part later also. Good writing is not the thing. It's a good handwriting is only your supportive thing. Okay, it's not only thing which the marks will be allotted. There are many other factors are there to see. Okay, so you need to concentrate on the presentation skills rather than the handwriting. Okay, presentation skill is more important in the examination point of view. And next thing is about preparation. Map your general rule for answers. Map. See, once you study the subject, you understood it, and think what are the possible questions from that topic, whatever you have read. See the old question paper and see that this question was asked previously also, and how to answer this question. That mapping should be there. Once you see any topic, if this question will come in the examination, what all thing I will write, how to write. This is what the mapping you have to need to prepare for. There are two type for Ayurvedic answers or something different mapping are there, and for the modern answer, because expectation from the Ayurvedic and writing of skill about Ayurvedic answers and modern answer both will get differ. Okay, that we will discuss next. See, for Ayurvedic type of answers, for example, you are asked for the Chaturtha Masa, a fourth month of Garbha Masanumasika Garbharuddhi Krama. Fourth month is the question for the thing. Question is there for 5 marks. So what many people will do is for Chaturtha Masa, they will write four or 5 line shloka, then they will write the meaning of the shloka. They mention the reference. Okay, it will take about half page. Okay, answer is over. Fourth month they have asked, I have written about the fourth month, shloka I have written, reference I have written, expression, that's not expression. There is a translation in English you have written and over the answer, and you think that you have written the answer. No, definitely that is a very bad answer if you are doing that one. Do not do this type of mistake in examination. Introduction part, see, you are writing essay, remember, okay? Introduction part should be there fourth month of, according to it is not, you need to understand the question also. Chaturtha Masa is there, then Chaturtha Masa, why this has been asked. Chaturtha Masa, see, all authors are explained about Masanumasika Garbharuddhi Krama. Even Charaka also told Chaturtha Masa, Sushruta also told Chaturtha Masa. Many other Garbha Upanishad, Kashyapa, everybody told about it. But Chaturtha Masa is there. Then what you do? You have to take out 2 or 3 points of introductory point where you can mention where this topic is came from. Take Charaka, Sushruta Sharestana reference, if it is possible. One reference you keep in mind. For Ayurveda, it is only second, third, fourth, fifth, and sixth chapter if you and ninth chapter if you remember. Which topic, which point of the syllabus will be chosen from which chapter? That is more than enough to write the references. Don't write the number of the shloka. It is going to be very difficult to remember. At least remember which chapter of Sushruta Shareera this question was asked from. For that, you can use a reference and write the shloka. Write the shloka. See, many people first preference is by hearting the shloka and telling for Masana Masika Garbhate from the Shareera Hastana, the so and so chapter it has been taken. A reference, many people may write it. For those students who do not want to write the shloka, they can write directly meaning and mention the reference, and in place of shloka, you are writing the meaning. That's it. Right? If you do not write the shloka, write the meaning. Okay, you are all right is there. You can remember the meaning of the shloka and write the meaning only. If you don't want to by heart the shloka, rather remembering the meaning, it is very easy to by heart the shloka and remember the shloka. What I feel is. But if you do not want to by heart the shloka, write the meaning. No wrong in that, and mention the reference of that. Okay, and in the place of shloka, you are writing the meaning. Okay, many people what they will do, they will write the shloka in Sanskrit, then they again translate in English. See, evaluator is already he is an well experienced and well knowledge about what question is asked, what should be the answer. You have written the shloka, then you are writing the meaning in English, same meaning, and you think that is an explanation. No, that is not the explanation. That is a translation. Explanation is something is out of that meaning. What you have understood, one or 2 point you take that point, and for example, many things. Chaturthe Masi, 4th month has been told. No, for example, I am taking. Okay, in that 1 or 2 technical terms will come. For that, what you discuss, it will become a description. Okay, don't write the meaning of the shloka after the shloka. What you are writing is about the description of the particular points which are there in the shloka, that you have to do it. Later, the conclusion or opinion, whatever the conclusion you can do from the Ayurveda, you can do the conclusion, or your opinion you can put forward. Nothing wrong if you do any wrong conclusion or wrong opinion you have given, but it should be some sensible according to your view. All these things will not be there in the textbooks. Textbooks or any book you are referring, they will provide you only information. Description and conclusion part they won't provide. Okay, it is up to you how you prepare your answer well. Modern answers are very simple. Introduction of anatomy is about the function of that particular topic. For example, liver is a question, then introduction will be it's a function. Okay, 1 or 2 functions of it you can mention as in the form of introduction. Then immediately after the introduction, draw the diagram first. Many students I have seen that they will draw the diagram later after writing the explanation. No, don't do that one. Immediately, see, evaluator will start searching about the question. Question number 2, question is liver. Then he start reading your answer. Once he see the diagram, his picture in his mind will change. I told you, no, you have to make evaluator very easy to evaluate your answer. Once he sees a diagram, he will think that whatever you have written below is about the same diagram and same topic. He will get concluded it. Next, he will see your answer and we find some explanation are very related to the topic. He will decide the marks and he will give 3 or 3.5 like that. Okay, do not make evaluator to read your answer. Make evaluator to see your answer. Okay, that is main thing you need to remember. Then whatever the explanation is asked for, you write the explanation. Then write 2 applied aspect. They asked or not, write 2 applied, because I have seen and I have come across, I have seen many of my seniors, colleagues, juniors, they expect applied anatomy to be written. Okay, then only they will give. So why to make them sad? Because, and you write about they asked or not, whatever question is there related to names of applied anatomy. I'm not asking to explain applied blood anatomy of that particular organ. Mention 2 names of a blood anatomy related to the question which is asked for. 2 for 5 marks, 3 or 4 for 10 marks. If you mention, definitely you are going to get good amount of marks. Okay, next slide. Okay, same thing which I have discussed. Introduction, context of reference for question per topic asked to explain. Mention at least a main acharya with his reference sthana, chapter name, where this topic is explained in Samhita. Okay, that will become an introductory part for Ayurveda. And shloka with the reference. Do not write a meaning directly below the shloka as you have written the same thing which I have discussed. Okay, and write 2 or 3 shlokas one by one. Then write whole meaning of the theme of the explanation of that. For example, this if I ask this question, you can understand in a better way. For 5 marks, see 3 marks question is not at all there for your curriculum in the NCISM. But usually in the previously there were 2 marks, then it was converted to 3 marks. The question were asked like Shuddha Shukra Lakshana or Shuddha Artava Lakshana. Okay, Shuddha Shukra Lakshana, everybody has by heart that shloka, 2-line shloka, 2-line meaning. There is very possibility that same question may come in a 5 marks. So what you write? 2-line shloka and 2-line meaning, and you expect 5 marks to be given? No. It's not like that. It's not possible to give 5. They will give again 2 marks only. They have asked for the 5 marks. Think about if it is not sufficient answer, then do not one by one word you need to describe it. What is each and every word, right? Like whatever the component of the shloka explanation is there, you need to mention the word and what actually it seems to be. And for Shuddha Shukra Lakshana, if you know Charaka's version, Sushruta's version, Astangurdev version, many 2 or 3, don't write whatever you are written in notes. 1 shloka on meaning, 1 shloka on meaning, shloka meaning. No. Do not do that one. Once you know our question is asked for and that answer, you know 4 or 5 shlokas. You are writing the shloka. Then if you know the shloka or 3, 4 shlokas, then write one by one shloka. Then while explaining the meaning, you include the meaning of theme of all shlokas in 1 or 2 lines and leave that one. Don't waste writing each and every meaning of the shloka. If you are doing main thing, you are wasting your time there. Next, about description, which I have discussed it about, and conclusion or opinion, which I think I have in previous slide. We have discussed this one, and you can take a screenshot and you can read clearly after later the session. Next. Now we will come to the time management part. See, many people we know how to manage the time in examination. Many people do know. First thing you should know this thing, like see, for long essay, 15 minutes per question. Okay, keep this one, 15 minutes per question. For one question, 15 minutes, right? There will be 4 long essays, questions will be there. Then it will take 1 hour. Okay, short essay, 7 to 7.5 minutes per question. And there will be 8 questions will be there. And again, it will take 1 hour. MCQ, 1 minute is maximum. It's not possible to answer. You can answer within 10 seconds. That's other matter. But still, we'll take 1 minute per question, and 20 MCQ will be there. 20 minutes will be there. Okay. So if you follow this one, then you can solve whole question paper within 2 hours and 20 minutes. 40 minutes will be there. Extra time, buffer time for touch up, left out explanation and clean presentation. Okay, so remember 15 minutes for long essay, 7 to 7.5 minutes per short essay, 1 minute for MCQ. Okay, I will come to this point later once again. Remember this one. 15 minutes for long essay, 7 to 7.5 minutes for short essay, and 1 minute for MCQ. You have to complete your answer paper within 2 hours and 20 minutes. Okay, I'll come to the time part later. You remember this one right now. Next slide. Okay. Once you enter in examination hall at 8:30, you have to complete every given possible markings and complete everything, and you have to sit for 9 o'clock till the 9 o'clock. 9 o'clock, the paper answer question paper will be given to you. So first thing what you have to do is the understand the type of question. See, type of question here. There are some questions. I will go with this explanation and I will see that. Too long and time consuming question, it is there or not. For example, I will come with this one. Explain Masana-Masika Garbharuddhi Krama. 10 marks question is there. If this question is there, you have read it very well. Your teacher have taught you very fine, and you have heard about 7 to 8 shloka very nicely. Okay, and it is very favorite answer. And this question is most possible question to ask in the examination. So what do you think? You will choose this question to answer at initial level? Okay. Explain classification of marma, 5 marks. Classification, whole classification of marma. All classification of marma. Okay, do you think it is this question or 10 marks question is there? Is it possible to complete the answer within 15 minutes? Or classification of marma, whether it is possible to write the answer within 7 or 7.5 minutes. Explain folds of peritoneum, 5 marks question is there. Is it possible to write whole folds of peritoneum within 7 minutes? You need to understand, and that's why you need to prepare mental preparation for the examination. This is required. If you think this question will take more than 10 minutes for more than 15 minutes for the long essays and more than 7.5 minutes for the short essays, then they are secondary choosable questions. Okay, they are not the proper questions to answer initially. Okay, so this is how you have to think on the answering part of this question. Next, too short questions. Too short. It is not at all. Even 15 minutes is not long enough to write the answer. So time is too long. Okay, for even 7.5 minutes is even more time compared to the answering. For example, Shuddha Shukra or Shuddhartha Lakshana, you can complete within 2 minutes. Okay, why to wait for 7.5 minutes? Okay, such too short questions are there. And explain Karma Purusha and explain blood supply to stomach. Okay, whatever you have thought, no, in that way, these questions are within 2 minutes you can complete. But you need to explain more. So such questions are also you need to discuss on the how to write these type of questions. So understand the types of question: too long, time consuming, and too short and too short questions. You need to understand this type of questions. Next thing is a plan to attempt. Okay, what question you are going to attempt first? First attempt two shorts, then attempt average questions, then attempt long explanation question. That will come by your experience if you see the questions. Shuddha Shukra Lakshana is too short. I will write those answers first. Then average time taking. This question for Garbha Poshana, it will take average of 7 minutes. Attempt second those questions. Then Masana Masaki Garbharuddhi Krama or Marma explanations will come later. Explanation, the last choosable plan of attempt questions. Okay, first answer, first attempt those questions which will take less time. Okay, so that you will save more time while explaining the too long time taking answers. Okay, next is know where to use color pencils. See, color pencils are allowed in the examinations. Explanation writing will be in the black ball pen. because they are going to scan, and black will be very good scanned. You can use blue. No one will tell no, but university insisted black pen has to be chosen. And diagrams, many people have that wrong thinking that we should not use colors in examination. University is already mentioned in the rule that a red color, blue color, brown color, yellow color, and green color you can use. Pencils can be used in the diagrams. And if you use this color, exam evaluator will be well impressed and give you good marks. So use colors. Red color for the artery, blue color for the vein, yellow color for the nerve, and green color for the tendons or ligaments. You can use colors. Okay, so use colors for the better explanation of the your answer. Same thing, you can do it. And major thing, whoever are there girls, just look at your clock. Is it possible to see the time? Okay, so use good analog clock for the eye on clock, because you are writing on the time bonded answers are there. We have to look one eye on the clock and writing it. Immediately when you look at the time, you should understand the time. Okay, so for that you need to have a good wall clock on your hand, rather than having very tiny clock in your hands. So use this is analog clock. Use analog clock where you can clearly mention about the minute by minute, you can assess it. Okay, and bit analog clock and skip answering. Big analog clock you need to use, and because you are writing on the time bonded, okay, carry watch to the examination hall, not Bluetooth watch. Okay, digital watch are not allowed in the examination. If you are well versed and you are habitual to the Bluetooth watch, then forget, it is not going to allowed in the examination hall. Purchase some good analog clock. And main thing is decorate your answers. Okay, decoration of your answer is also needed. See, once if any guest is coming to your home or your room, you will regular time, that will be very messy. But when the guests are coming, you will decorate your room. Why? You want to impress the guests who are going to come to your home or room, no? That's why your evaluator are going to give you marks, how you written. So why can't you decorate your answer? Nobody will give much importance to the decoration of the answers. So give some boxes around the diagrams, underlines under some very important points, and numbering the points and sub points to make evaluator easy to understand how many sub points you have written, how many points explanation you have written. Easily he will remember. Don't just like you can see the bullet buttons which I have used. Rather than that, if I have used the numbers, you would have understood easily that how many points and sub points I have used to explain the slide. Like that, you need to mention the numbers in the numbers of sub points and points of explanation. Rather than arrow mark, use numbers so that evaluator easily understand how many number of points you have explained. Okay, next slide. This is one same thing again, how to manage time in examination hall. I'm speaking about examination hall right now because you are very interested in how to manage the time in the exam. So think which question can be attempted, can be finished within the stipulated time, which I have early mentioned. Stipulated time means after 15 minutes are over. Okay, or 5 minutes for 5 marks is 7 minutes for 7.5 for short essay is over. Once you start answering, keep eye on the time. What you have, when you have started, see the time, and when it has to complete, see that target time also, and start writing it. Okay, and after stipulated time, if your answer is not completed, then leave that answer, skip to the next question. You are writing one answer, 15 minutes is over in a long essay. but still your answer is incomplete, then don't waste time writing the same answer continuously. Skip that answer. Anyhow, this time very nicely university has given question number and the page are also allotted. Initially, it was not like that. We have to make gap for the paper. Now they have given stipulated place for the stipulated answer. There only you have to write it. So leave the answer there only, go to the next question and start answering that one. Again, see the time, what time? 1 o'clock I started, 1:15 I has to finish. Right, start writing about it. 1:15 it happened, and wherever you are, leave the answer, go to the next. If you do like that, after 2 hours and 20 minutes, you will have plenty of time to touch up your left out half answered questions. So half answered whatever you have left out, you have plenty of time. There you can complete whichever answer you have left it out. Okay. See, once in 2 hour or 2 hours 15 minutes or 2 hour 20 minutes, if you completed your answer, your confidence level will be very much high that I know I have attempted all questions, and still 1 hour or half an hour or 45 minutes I have there in my hand to even write it in a full way. So in that confidence, you can do a better decorations of your answers. So follow this one instructions so that it will be very helpful. Later you can decorate it and highlight the very much important points wherever you have answered it or wherever you have left it out. Okay. And one thing very important, do not leave any unattempted questions or unanswered questions. Don't leave any questions. See, no, I don't know whether being a professor in the subject, if I tell it or not, but this is a fact that if you have written anything related to the topic which you do not know the answer, for example, they have asked about the blood supply to stomach. I don't know what to write about the blood supply of the stomach, but I know the general rule of writing about any blood supply of the organ. But I will write about the stomach at least. You may not get full marks, at least some evaluator will provide you some marks. If you have, this is it, which I do not tell about other evaluators. I have allotted all answers, all questions, and I have given the marks, and marks a student got is about 45 or 46. And he is lagged behind of 4 to 5 marks to get 50 marks. What I usually go, again I will go back, I will try to give even more marks for the answered question, and even he has written wrong answer also, I will provide answer to that question also to make him up to 50 marks. Okay. To at least in a marginal way, if you are getting at least sometime what happens, I have given 72 marks and I know 75 marks I will give if he or she will become a distinction. Very good answer paper is there. Why I should harm her or his paper? Then I will give wherever I have given 3.5, I will make it 4, 4.5 like that, so that it will be benefited for the student. So do not leave any unattempted questions. Answer all questions. If you do not know the question also, related answer you write. Do not write in place of stomach, don't write about the liver. Okay, that is a blunder. Okay, don't do that one. At least if you do that also, some or other way in a life-saving answer that will become. So don't leave any unattempted answers. Okay, next. This is a time management before examination. Okay, that is another thing which I have discussed is about till now is about that how to manage the time in exam. And this is very beautiful timetable which every student will have. I hope many people will be having the same thing, no? Waking at up 7 o'clock. Okay, see, go through this timetable. 90% I think it's our timetable only. It means many people will be following 7:30 to 8 o'clock. WhatsApp, Facebook, and Instagram checkout. and doing some status and checking. Once you give the status, and it will be like milk on the stove. If you do not look at every minute, there will be no samadhana illa. Okay, and 8:30 to 9 o'clock, no one will miss the breakfast. 9 a.m. to 5 p.m. college. 5:30 to 7:30 again breakfast, chit chat, gossip, and stories of friends. 7:30 to 8 p.m. thinking of what to study. 1 hour will take. 8:30 to 9:30 asking friends for the copies of homework भर दिए ना अरे तुमने होमवर्क जो दिया था वो किया है क्या अगर दिया है तो ले आओ आकर रखने के लिए 1 घंटा बाद में 9:30 to 10:30 डिनर आफ्टर 10:30 to 11:30 again 11:30 to 12:30 you are trying something 12:30 to 1 a.m. friends room to check out whether they have slept or not. And 1 a.m. to 2 a.m. sleeping with mobile checking, you do not sleep. Anyhow, you don't know when you are asleep. And 2 a.m. to again 7:30 sleep. And you'll tell that sir, minimum 5.5 to 6 hours sleep is needed for a good health. Okay, this is the timetable of usual regular student. Even I have done this one when I was student. Okay, and nothing wrong in this one. It will be there usual when we are not in study mood or when college is in the initial level. Okay, and next slide. Immediately what happens? Next slide. The timetable will become, every student want to make this timetable. Okay, 4 o'clock I will wake up, 4:30 to 5:30, 5:30 to 6:30, 6:30 to 7:30, 3 sessions of studies. Again 7:30 to 8:30, getting ready to college, 8:30 to 9 o'clock breakfast, 9 to 5 p.m. college, 5:30 to 6:30, 6:30 to 7:30, 7:30 to 8:30, and 8:30 to 9:30. These are session 4, 5, 6, 7 session of studies. Then 9:30 to 10:30 dinner, 10:30 to 11:30, 11:30 to 12:30. Again study sessions, 9-hour studies we will do. And everybody dream will like this and will sleep. 12:30 will sleep and again 4 o'clock you will wake up. Only 3.5 hours you are going to sleep. Whether do you think this is a good timetable? This is also as good as bad as the previous timetable also. If you do this also, you are going to fail. If you do that also, you are going to fail. So do not be in this aggressive study timetable. This is actually, I have put it this one because my student asked, so what is proper timetable? So make my timetable and give me. So if you do this one, this is also bad. And you think that 9 hours are there. Sometimes it will be good at the time of examination. 1 month before examination, if you follow this one, it's good. No issue. But daily you cannot do this one. Okay, what in a previous timetable what we are doing, that is also not good. Okay, whatever you do, it should be constant and study for the whole year. Whether the examination near or far, one timetable should be fixed. Next timetable, which I think it is a proper timetable and followable timetable. You can follow this one, which I can suggest every student to go through this one. I do not suggest what to, and you can make many changes according to your need. 4 a.m. wake up, do not get shocked. 4 p.m. it is possible. 4 p.m. wake up. 4:30 to 5:30 revision of daily study and planning of the day. See, hour before sleep and after getting 1 hour, whatever you study, that will be main memory boosting time. Okay, even in olden whatever in Veda Kalas and all, they used, I don't know, but there is a literature that they used to do follow this one. 1 hour after wake up and 1 hour before sleeping, whatever they revise, that will be very much well organized, and it is possible for them to remember more than lakh shlokas grantha as in the form of memory. So you want to improve your memory, then you can do this one. Okay, you can improve your memory. Very good, and this will give you a very good result also. Daily, there are something which has to be read regularly. For example, shlokas you need to read every day. Don't think that I will by heart it. It came or not. Don't think about it. Read something regularly, which is if you think it is a thing you have to read it regularly, then do it in 1 hour, 4:30 to 5:30. Read regularly on that one. And 5:30 to 6:30, one study session. You can choose any subject to that one, whichever you feel hard. Choose in 5:30 to 1:30. Don't easy. No, do not choose study session one, easy subject. 5:30 to 6:30, whichever subject you feel it is difficult for you, choose that subject. 6:30 to 7:30, definitely do exercise. You can go for a walk, you can go for a brisk walk, serious walking. Okay, don't only for rounds purpose and don't use mobile phone while walking. Even for music is prohibited during walking. ಏನ್ ಮಾಡ್ತಾರೆ मेनी पीपल क्या करते हैं ना ये कान में गाना सुनते वॉक करते ओके दैट इज वो बहुत गलत है डोंट डू दैट वन गाना सुनते वॉकिंग मत करना ओके क्यों कर रहे हो उसको याद करके वॉक करना क्या होता है अगर हम मोबाइल देखते खाना नहीं खा सकते ऐसा ही मोबाइल गाना सुनते वॉक नहीं कर सकते सो परचेज गुड shoes, go for a walk, seriously go for a walk, or if you have a cycle, go for exercise, do the cycling of 1 hour, or you can join any nearby gym if it is possible, or you can do yoga. Okay, so but seriously without mobile. Okay, and 6:30 to 7:30, that is exercise time, and 7:30 to 8:30 getting ready for the college. You iron your clothes, go to bathroom, finish everything and get ready for the college. 8:30 to 9 o'clock breakfast, good nutritious breakfast. 9 to 5 o'clock you will be in the college. Maximum your work of studies of college in the college hours only you have to complete. As much as possible, complete your college works in college only. Don't bring that college work to room. Okay, even it may be a homework given by the lecture, try to complete in the 5 o'clock only. Okay, because I know many gap periods are there, you can complete within that time only. Do not take that homework burden to the room after 5 o'clock, as much as possible. 5:30 to 6:30, high protein snack, 1 hour snack, nobody will do it, but you still take that one. 6:30 to 8:30, there should be 2 study sessions. Do not skip this time, even on a regular day, during the exam time also. This should be study time forever. There should be it may be exam time or it may not be exam time, even in holidays. 6:30 to 8:30 study time, do not skip that one. Okay, because you are student. Once you complete your student life, then you can do anything on 6:30 to 8:30. You can go for the practice. Replace 6:30 to 8:30 in the form of a study. Go for the practice, but do not skip this one for any reason other than the studies. Going even many times, some students are very strict that they even do not go for the film in this time. Okay, and 8:30 to 9:30 dinner, and 9:30 to 10 p.m. See, 9:30 to 10 p.m. half an hour revision of whole day whatever you have read about. See, brain is one beautiful machine that whatever you have read, in after that if you are going to sleep, whatever you have read, brain is going to organize in a very well manner and keep it in the memory. So whole revision of the day, what you have read about it. See, just read about whatever you have done the work in a study session 1, 2, and 3, and in the college, revise them daily. Do this the habit. Okay, and 10 to 4 o'clock, 6 hours you sleep. Do not decrease the sleep hours. Sleep is mandatory, it is required. Minimum 6 hours you sleep. Okay. See, this is what on the request of my students, I made this timetable for them. And I am telling you also, this is what the practically possible timetable, and disturbance will not be there. And see, this can be followed from Monday to Saturday. And I don't ask you to follow the same thing on Sundays. Sundays strictly no books, nothing. Okay, you can do anything possible, fun, enjoyment, films, whatever you want to do it on Sunday. And from Monday to Saturday, work like a donkey. On Sunday, don't do any studies. Give a relaxation to your mind and do whatever monkey things you want to do it on Sunday. But Monday to Saturday, be very strict on yourself also. Okay, next. So I will conclude my talk by this one. See, repeated study will become your habit. Okay, and repeated habit will become the attitude, and continuous sticking to your attitude will become your character. And remember, 85% of the success in the life, not only in examination, 85% of the success in the life is because of the character and the attitude, not about your knowledge, whatever you know. Okay, so repetition is the main basic key. So once you read and if you remember in the examination hall, it is not possible. So anything you want to achieve, then do it repeatedly. There is no other shortcut. Okay, next. Thank you. Thank you for patient hearing, and thank you, madam, and giving opportunity to speak few words in front of all. Thank you.
Thank you, sir.
Is there any question? Is there? You can ask me. No issue. Related time management.
No questions so far. No questions so far. Thank you, sir. The session was
Thank you, ma'am.
really informative, and it had a schedule of students from first day to last day of college. Hope the students apply it. Thank you, sir.
Hopefully. Thank you, ma'am.
Thank you, Harshavardhan sir. Thank you, Rubia ma'am. Our respected chairman sir was very eager to address us, but due to his busy schedule, he is not available today. But he has conveyed our his best wishes to all of us, and I'm very thankful to him. Now, sir, Harshavardhan sir, there is one question.
Madam, yes, ma'am. Yes, ma'am.
The question is internal assessment and Viva marks to added in practical?
Yes. This time, actually, initially there was the IA marks, Viva marks usually added in the theory, but later it was discarded for the RS6 batch. Up to RS5 batch, Viva marks were added to the theory part, but after RS6 batch and RS7 batch, whatever the NCSM batch is there, for them, the Viva marks is not going to add. Purely that will be a theory part separate. And for the practical marks, IA marks and the Viva will be going to add their own.
The second question is, sir, from Dipti. Question is, what should a teacher approach to just pass the exam or become doctor?
See, many people will ask this one. I to come across, I want to pass the examination. See, it is not false also. Passing examination is very easy. It's not at all difficult, because how much possible easy way they have kept as a passing marks. Even NCSM is instructed and framed the syllabus in such a way that no one should fail. So passing is not at all difficult. Forget about the passing. You will definitely, if you do the regular work, you will definitely pass. No need to worry. You are definitely going to pass. Think about if you want to score more, then we can do some exercise on that. But passing is, if you go through the pattern of syllabus and the question paper patterns with the IA marks and the electives to which is going to added, and the question paper pattern, no must know part only they have to ask from this syllabus only, this point only. If you solve smartly the syllabus point, hardly 10 or 15 questions are there for the 10 marks and 30 to 40 questions for the 5 marks. If you thorough with that questions only, what is not only pass, forget about the passing, you can score very good this time. And it is possible to become a good doctor. No, practice is the main thing which make you good doctor, not the marks. When you start practice and patient will teach you patience and prescriptions later, then you are going to become a good doctor, not by the degree. Degree anybody will get it.
Okay, thank you, sir. Next question is by Anurag. Question is it mandatory to write 5 pages for 10 marks and 3 pages for 5 marks?
No, not at all mandatory. That is a maximum limit which is given by the university. Okay, that is a maximum limit. Even for the 2 or for 5 pages, I will tell you something about 1 page here and this page half. They have written for 5 marks. I have given 4.5 marks. Okay, I have given in the evaluation. It does not mean that you need to write all 5 pages. Some people have larger handwriting and some people will leaving one line by one line. Even for them also that page should be sufficient. In that manner they have given that amount of pages. You need not to worry about. You need to concentrate on how much you have to write it. Don't count the pages. Only concentrate on your answering part and the decoration and presentation part. Don't worry about the pages, how much page you have. Need not to worry.
Thank you, sir. Next question is by Dr. Anish. How much will add and to which subject it will be added? How it's calculated?
What added? No, I did not get what to add it.
Yeah.
What to add?
It is not mentioned, sir, in question.
Added to marks or some? I did not get it. Read it once again.
Okay, sir. How much will add and to which subject it will be added? How it's calculated? It is not mentioned, sir. Maybe marks, sir.
Maybe marks. See, valuation is person to person. It will differ.
Namaste, sir.
But namaste.
Namaste. Sir, the question was not that. The question was in current elective system, they have mentioned like that mark we should collect and submit to the university, and university will be allotting that marks in their practical examination. So how much marks will be added to each subject, or it is selected for any specific subject, and maximum how much marks will be given?
See, electives will be there only for the not Rachana and not for the Kriya. It is only for the Samhita Siddhanta department, only for three subjects: Samskrita, Padartha Vigyana, and Ashtanga Hridaya. There will be electives are allotted, and it is online course, and they are going to add up in the how it is going to add up. It is elaborately given in a syllabus book in page number 40. If you have a syllabus, download the syllabus, go through the syllabus where they are going to add up everything, how much marks they are going to provide for the electives. They are going to give you medals of bronze medal, silver and gold medal for the electives. See, that is going to add up in the which is going to come in the your university this manner, which is given in a university pattern only. Table number 6, page number 40, and 6C pattern. You can see which is very clearly given in your syllabus book. Go through that, you will understand. Definitely, it is very clear.
Okay. Thank you, sir. Next question
Okay.
is by Dr. Bharat. How to create interest and curiosity regarding the Rachana Shareera subject in students?
This is very good. This is why my favorite question I want to answer very happily. See, Rachana subject is which is the most boring subject if you study seriously. If you start studying seriously, it will be like what you call, this is like an hell of a subject if you want to go through it. So only thing is how much you understand, that much you take first. Second thing is make friendship with the anatomy, not the enemy. One thing. Second thing, whenever you start reading it, I usually follow this one. I dance once I understand some important topic. For example, if I understood and I remember the any one shloka or in the whatever the shloka you are coming through the syllabus, once I understood it, I enjoyed like in taking, okay, make one chocolate, and I used to eat that chocolate and enjoy and celebrate whatever I have read it. And I used to talk with the books, what they are telling, something which is very boring telling, I used to tell it, what boring you are telling to me. I used to speak with the textbook so that it will tell same thing again. Again, you are telling the same thing. If you have a humor in yourself, you will never become bored with not even with the Rachana Shareera, not any subject will not become a boring. Enjoy it, make fun of the subject. No, I will tell, देखो रे इसमें 5 लिगामेंट है लीवर में, क्या है इसमें 5 है बस, 6 नहीं है, क्यों 6 नहीं है, पूछो लीवर से क्यों ये 5 ही है, तो बताता नहीं ऐसा. Only one 5 surfaces, only one border is there for the liver. क्यों? अगर अदर 4 border तुम खा लिए क्या? तो ऐसे उसे मजाक करना, उससे बातें करना, सब्जेक्ट से, टॉपिक से बातें करना, इंटरेस्ट अपने आप आते जाएगा जब तुम मुस्कुराना सीखोगे. अगर तुम बहुत मुंह क्लोज करके मूड सप्रेस करके सीरियसली पढ़ोगे तो एनाटॉमी सब्जेक्ट तुम्हारे लिए नहीं है बेटा, छोड़ दो. Anatomy is very fun subject if you are very funny person.
Thank you, sir.
Yes.
Next question is by Devanga. Is there any compulsion to get pass? No. I have to read a complete question. Is there any compulsion to get pass in all subjects in single attempt only?
See, there are 3 departments in the first year. One is Samhita Siddhanta department and Rachana department, and from the Kriya department, right? In Samhita Siddhanta department, you have subjects like Sanskrit, Padarth Vigyan, and Astagurva. Okay, they tell that among these 3 departments, 2 department has to be get cleared. Okay, see, either Rachana and Kriya, if you pass, okay, right, you are eligible to write the 3rd year examination. Before that, you have to pass through the other 3 also. Suppose if you have cleared Sanskrit, Padartha Vigyan, and Ashtagruhya, you are not eligible because all these subjects will come in the Samhita Siddhanta department. Okay, and 2 subjects from the Samhita department and Rachana. For example, I have passed Sanskrit, I have passed Padartha Vigyan, but I have passed Kriya Shareera. I have failed in the Rachana Shareera, and I did not clear the what Ashtanga there. Then also it is not possible. One department has to be cleared. Here, one department, one subject is Rachana and Kriya, but Padartha Vigyana, Samskrita, and Ashtanga, all 3 subjects will make one department. So it is mandatory to pass all 3 subjects from the Samhita Siddhanta department and one department, either Kriya or Rachana, to get clear with the first year. Then you can have the carryover basis. 4 options, and you can write in the third year.
I think all delegates are happy with your answer. So,
Thank you.
Harshavardhan sir, you have explained this difficult topic in such a simple way, and very small elements you have taken in your consideration. And I think if a student follow all the instructions given by you, he can dream big, as you said earlier. So now I hand over mic to our Mohsin sir, Assistant Professor, Rachana Shareera Department, Dr. N.A. Magdum Ayurvedic Medical College, to deliver his vote of thanks.
Thank you, madam. Good afternoon to all. I deem it a great honor and privilege to propose vote of thanks on this memorable occasion. First and foremost, I thank our special guest speaker, Dr. Prahlad Subbannav sir, who despite his busy schedule has found time to grace this occasion. Thank you, sir. And I also express my heartfelt thanks to Dr. Harshvardhan Balihal sir for his valuable contribution in this webinar. Thank you, sir. I also express a heartfelt thanks to Dr. Rajendra Pakkanava sir for his encouragement, guidance, and continuous support. I thank our beloved chairman sir, Dr. N.A. Magdum sir, and Srimati Lalita Magdum madam for encouragement and continuous support. I thank our beloved principal, Dr. Ramesh Konkari sir, for his constant support, guidance, and encouragement. I thank to Dr. Ramgonda sir, Dr. Pradeep Dawde sir, and Mr. Santosh Patharwat sir for their constant support. I thank our technical chief, Mr. Bhana sir, and their entire team for their continuous effort and dedication throughout the webinar. I thank all the HODs of various departments and their faculties for their valuable contribution, guidance, and encouragement. I thank all the distinguished delegates present here who joined us with great enthusiasm. I owe special gratitude to the non-teaching staff who worked hard to ensure that the webinar become a grand success. Last but not the least, I thank you all the students for your cooperation in making this webinar successful. Once again, I thank you all. Thank you.